I see you, Bill.
Mr. Sutton, we're going to go ahead and put the title slide up, and then whenever you're ready, you can get started.
Okay. Making sure everyone is here since we're not doing a roll call. All right, good afternoon to everyone. Looks like we've got also everyone here. Not everyone is here. Okay, yes, Ms. Johnson House. So everyone is here. So again, good afternoon, everyone. Welcome to our Board of Education work session, calling this meeting to order. To get started, and we've got a lot of information to cover today, I'd like to open today's special called work session by making sure that the public understands what the board expects to accomplish today as we work toward a safe return to in-person instruction in Wake County. Today's meeting is the second of 3 meetings we have scheduled to review the details and the options available to us. I know many families are anxious for children to return to school. So are we. At the same time, we need to make sure we have done our best to ensure teachers and students are returning safely. During our first full meeting on this topic, which was September 15th, we reviewed the basic conditions that must be met in terms of operational details, staff readiness, and health metrics. Based on that information and follow-up questions we asked of school district administrators, we will use today's time to review and discuss specific recommendations from the school system leadership. No decisions will be made today. However, we have scheduled a final vote for September 29th, a week from today. That will give teachers and families time to respond to today's recommendations and allow us to consider final details before making a decision as a board. So again, a final vote is not scheduled for today, but we will review and ask questions about the recommendations made to us by staff in preparation for a final vote next week. So with that being said, we have specific outcomes for today's meeting. Those 3 outcomes are as follows. 1, a better understanding of the conditions that have led us to consider a return to in-person instruction. Secondly, answers to questions about the staff recommendations for in-person instruction, and to gain insight into the board's thoughts, ideas, and perspectives as it relate to a phase-in plan supportive of an in-person return. With that understanding of where we are in the process, I'll turn it over to Superintendent Moore to get us started. Good afternoon, Superintendent Moore.
And you're muted, Kathy. We can't hear you.
Appreciate that. Good afternoon. To get our conversation started today, I wanted to begin by listing the 3 conditions that we've been using since July to determine when schools would reopen for in-person instruction. More specifically, when the board asked us to begin outlining a plan for returning to in-person instruction, we've been basing our decisions about a safe return on the following 3 factors. First is operations. Are the supplies, materials, and processes we need in place and ready to go? Second is staff readiness. Have our teachers had the time, or will they have the time, to get back into their buildings and classrooms, understand the protocols, establish the practices, the processes, and be able to practice them, access training and information that they need to confidently return to safe in-person instruction? And then for metrics, have the health metrics been considered in the community, and are we meeting them? As we've reviewed these conditions, it is important to note that the safety of our staff and students has been the top priority in reviewing what a return to in-person instruction could look like. At our September 15th meeting, we addressed each of those three conditions or the dependencies that you find in the orange box on the left. And then we provided a checklist to the reopening that come as a result of examining those dependencies found in the box on the right. We then asked board members about their questions and preferences so we could determine what type of rotation to use, what grade levels to include in those rotations, knowing that the evolving data and guidance may impact our decisions at this time. For the sake of the public who might be watching this presentation, it's worth noting that this approach was first discussed more than 6 weeks ago at an August 4th meeting. The framework for making the decision on when to reopen has not changed since then. At the August 4th meeting, we announced that as a district, the goal is to be able to transition to in-person instruction as soon as possible, perhaps by the beginning of second quarter, with the prioritized scheduling of students returning by cohorts. Again, this is under the priority that governs all of it, a safe return for staff and students. The beginning of the second quarter for most schools is October 26th. I would like to add one final piece of context before we discuss the staff recommendation today. And again, this is for the sake of the public who might have been unable to follow previous meetings. The board initially approved the framework for Plan B on July 2nd. This is the framework in the plan called for the school district to establish a 3-week rotation, 1 week in person, 2 weeks remote for all students as soon as it was safe to do so. By July 21, it had become apparent that the community spread of the virus would not allow us to safely open in person on the scheduled first day of school. At that time, the board approved a Plan B transition, which delayed in-person classes. Plan B transition has been in effect since July 21, with teachers relying on and students in remote instruction. The question before the board today is whether we wish to make changes to the framework of Plan B transition, especially in the light of recent developments. And I want to talk about those evolving conditions a bit. There have been at least 2 important developments since the adoption of Plan B transition that will affect our discussion today. One involves the information collected as part of partnership with the ABC Science Collaborative. This is a group led by the Duke Healthcare System. I think UNC Chapel Hill is now involved as well. Research findings offered by the collaborative to this board make clear that compliance with a health plan is far more important than a specific metric when determining whether schools can operate safely. I can't stress this point enough. The health metrics in Wake County are clearly improving, but what will ensure the safety of staff and students is compliance with the health guidance. While the guidance is extensive, it still comes down to 3 basic rules. Wear a face covering at all times. Wash your hands frequently. Wait to ensure appropriate social distancing. We could say this at the end of every slide today, and it would not be too much. It is that important to a safe return. To help our staff understand what this means in more detail, the collaborative, the Science Collaborative, is offering weekly webinars with specific focus areas. You can see the topics listed on the slide, which are also going to be available to the public on our website beginning September 28th. During this time, we have also continued to provide schools with necessary supplies, resources, health guidance, and protocols. And the communication with principals and staff is ongoing, and it will continue indefinitely. To better organize the tremendous volume of new information required to operate during a pandemic, Communications Department has created an index that organizes hundreds of documents into 11 different categories that's available on the employee intranet. Those topics vary widely from health screening protocols, face coverings, behavioral health assessments, online instructional support. I'll talk more about that in a little bit. As decisions are made regarding the details of returning to in-person instruction, many of these same documents will be provided publicly and our website pages revised so that families and students are also familiar with the new rules and routines. And this will become places where teachers, families, students, and staff can get answers to questions. I'd like at this point, since on this slide I have highlighted the partnership with the ABC Science Collaborative, to invite Dr. Danny Benjamin, who is the co-chair of that collaborative, to provide some highlights and sort of important points from the webinars that have already occurred that align with the expectations that we're setting forth and the resources that we are providing to our staff, students, and families. Dr. Benjamin, I want to thank you for joining us this afternoon. I know that you're really busy and just coming off of another meeting, but would love to have some of your thoughts at this point based on the webinars that you've provided and the kinds of questions we're getting from staff.
Great. Thank you. I just want to define some terms for folks and some assumptions that are made when we present these data. The first term is around face coverings or masks. There are cloth masks, which cover my face and sometimes have loops around the ears and sometimes don't have loops around the ears. The cloth masks provided to schools have loops around the ears. Their integrity is, when studied, has been very similar to that of medical masks, which are what you might see folks in the operating room or interventionalists in the hospital wear, that has loops around the ear. That's a medical mask. And then there's a third type of mask called an N95 mask. That's a cone shape on the front of the face. Those need to be fit tested, and any type of facial hair precludes their use. And if they are not fit tested, if they don't fit well, it's early data indicates that they may even be worse than either an effective cloth mask or a surgical mask or medical mask. The assumptions on the data are as follows, that I'm going to present the data. The assumptions are that the children do not have symptoms, that the testing status is unknown, and that the either children in the school or children in the hospital or children in the clinic or children in the child care environment or children in the camp are wearing cloth masks, and that the staff are either wearing cloth masks with loops or medical masks with loops, not N95 masks. In those settings, if compliance with mask wearing is very, very high, secondary transmission is very uncommon. And in fact, secondary transmission tends to occur and almost universally occurs when folks break protocol. Typically adults break protocol as it relates to masking. Secondary transmission is defined as student number one comes into the after-school program with an infection. They are infected at home, for example. They come into the program. If they were to transmit to a staff member or to several other students in the room, those transmissions in that room are called the secondary transmissions. That's what we're really trying to avoid in the school setting. So if we document that the children do not have symptoms, if we don't send children to school with positive test results, and if children and staff are masked, then the secondary transmission is an uncommon event. It's not zero, but it is uncommon. And in many settings, the only times that it's occurring is when folks break masking protocol. I've been asked a number of times, should N95 masks be routinely worn? And that presents substantial logistical challenges, such that we are not doing that in the hospital setting, provided that patients don't have symptoms, provided that the patients are able to wear a cloth mask, and the physicians or nurses or physical therapists, occupational therapists, speech language pathologists, speech language therapists are able to wear medical or cloth mask coverings. We're not using them with asymptomatic children. There are logistical challenges with the N95 masks that bring risks to any large organization that want to use them routinely. And that's one of the many reasons why, even in the healthcare setting, we're using either the cloth or the surgical or medical masks. I've also been asked about HVAC systems and filters. This requires a bit of a longish answer, so bear with me. In any kind of infection that is transmitted via the air, like a respiratory virus or measles or tuberculosis, there is a need to define how high is that risk if I'm infected breathing on one side of the room and you're not infected and you're 20 feet or 10 feet away from me. In a respiratory virus like flu or SARS-CoV-2, that transmission, that high risk area is typically within 6 feet of an unmasked infected person. Transmission beyond 6 feet is, of course, anything's possible in medicine, but the majority of the transmission occurs in that 6 foot range. In contrast, infections that are highly aerosolized, such as tuberculosis, measles, varicella, there the patient who is 20 feet away is at very high risk. It's in those types of situations where negative pressure rooms and other sorts of changes to the environment need to occur for protection. Of note, the R naught, which folks may have been reading about back in March or April, that is, if I'm infected, how many people on average will I infect? The R naught for influenza is approximately 2 people. So if I've got it, I'm most likely to infect 2 others. The R naught for SARS-CoV-2 is somewhere between 2 and 3. It's probably around 2.5 if I'm not masked. This is consistent with a 6 foot high risk zone. The R naught, in contrast, for measles is 18. That's why if you have a child in the hospital with measles, they'll go into a room that protects the air from all other children and adults in the hospital, because it's highly contagious even beyond 6 feet. There have been theoretical concerns that SARS-CoV-2 might be aerosolized from time to time. And if you're doing things like intubating patients, testing patients for SARS-CoV-2. It's clear that you will aerosolize. It's entirely plausible that there will be some aerosolization if there's high intensity exercise or loud singing. But the vast majority of risk is experienced within that 6-foot space. And the infection by aerosolization is not something that we've been seeing in schools, hospitals, or throughout the pandemic. So it's a theoretical concern, yes, but it's not something for which in any other setting we are taking interventions, certainly in the healthcare setting, like we would with an infectious disease where there's true frequent aerosolization transmission, such as measles and varicella.
Thank you, Dr. Benjamin. I know that those were two areas that we'd received a number of questions about and that were the subject of two of the webinars that have already occurred. And just for staff who are listening, there is a reminder that you can access the entire ABC Science Collaborative site and archived webinars through Wake Connect.
Those those are available on our publicly available website, the presentation, as well as the videos.
I wasn't sure if that website was up yet. We thought it was September 28th, but we'll get that information out if it is available and up already.
Great, thank you. It's up today.
Oh, great. Thank you. So continuing on with the evolving conditions, the things that have changed since we initially adopted the Plan B framework. Second significant development since our last board meeting, even on September 15th, was the announcement by Governor Roy Cooper on September 17th. As you know, Governor Cooper announced that schools are now permitted to open in Plan A for elementary school grades K-5 only and after October 5th. This plan affects only kindergarten through 5th grade. It does reduce some of the social distancing restraints placed on classrooms and school buses, where some of those restraints become recommended versus required at this point. They're still recommended, but they are no longer required. It is important to note that the governor's announcement does not remove all social distancing constraints. Congregate settings like libraries, cafeterias, etc., remain with a requirement to social distance. Face coverings are still required for all staff and students. These are not optional. But Plan A does offer districts more flexibility as they consider a return to in-person instruction. Grades 6 through 12 remain in Plan B, not Plan A. The governor has not provided schools grades 6 through 12 with an option for Plan B. For Plan A. They remain in Plan B, or the district can choose Plan C. And that order maintains the requirement of 6-foot social distancing in all school settings for grades 6 through 12, including the classroom. These are the same requirements that have been in place since July. For all grade levels, districts may choose a plan that is more restrictive, but not less restrictive than the governor's order. Another evolving condition that I'd like to make mention of, and this is late breaking, we've just pulled the preliminary information together. We're not quite done with the report, but we can talk a little bit about what's in it. We recently conducted a teacher survey. We do have some of those results back. We do not have the parent ready yet. We have to do some translation because some of that is done in Spanish as well. So that'll take a day or two longer. But we do have some preliminary results from the teacher survey. Couple of things to note here. The most preferable option for teachers was really to look at pre-K2 coming back first, as well as regional special education students, and other students would remain in remote instruction until a later time. Pre-K5 was the second most preferred option to bring back. Roughly 30% of teachers said that they anticipate needing to support all three modalities, and I'll talk more about that later. In-person instruction, remote learning from Plan B students when they're in that rotation, when they're not in the building, and virtual academy. Overall, WCPSS teachers so far this year are reporting spending significant time planning for instruction outside of the school day to support remote learning to a greater degree than they did before the pandemic. I think it's been a change, obviously, for everyone. Ensuring that staff are comfortable and proficient in using and modeling the needed health and safety procedures is also critical to ensure a successful Plan B. Teachers remain concerned about a return to in-person instruction. And as an example, I think there was one piece of data that showed that when ranking options about returning, the more students an option reflected in person, the less favorable teachers were about that option. So that's sort of the evolving conditions that have happened in the last couple of months. In looking at the operational pieces around the components for a return to in-person, there are a few things here that we've talked about already, like to continue to point out again. So this is PPE and supplies, for example. As of today, the district has acquired 900,000 reusable face coverings, 900,000, 10,000 gallons of hand sanitizer, sanitizer wall mounts, 10-ounce bottles of sanitizer for every classroom, as well as other assorted PPE that may be necessary, shields, gowns, gloves, that sort of thing. Additional cleaning products are at the schools, or they are in inventory for replacement when needed at the schools. New cleaning processes are in place for when students return, and signage reinforcing the 3 Ws has already been provided to all schools. We have had reports from staff saying that they have not seen or do not know how to access these supplies. When we get that feedback, we work directly with principals to ensure what inventory is actually in the building, that it is adequate, and that it is in the right hands. After delivering that initial round of supplies to schools that was completed a few weeks ago, we are now in a second round of deliveries. And this is based on principal feedback about additional needs that they have reported. We are checking with schools at least one more time, and this will actually be an ongoing process, but at least one more time prior to the return of students to ensure that if any additional supplies are needed, that we get those in there. We are maintaining a centralized inventory of supplies as well for when schools need to replenish. And then finally, our transportation routes have been established for the Plan B 3-week rotation that was approved earlier, and those are ready to go. Second major area in operations really is about the health guidance and the daily practices. Full understanding of this is critical for staff and students to remain safe. And based on the guidance provided by the ABC Science Collaborative during the webinars, full compliance with these health guidance and practices can literally make schools safer than the general community. A critical part of compliance is creating a culture of ownership. Guidance that has been provided to staff has been written for students, does include consequences for repeat violations. That's for staff or students. However, the successful compliance does depend on each person's willingness to intentionally support the health of their community. Because that's the expectation that's communicated and the culture that has to be created, an intentional support of the health of our community. In school for sure, and outside of school as well. And this critical component, this is the critical component for how we build the confidence of our staff, students, and families that we can safely return to in-person instruction. Again, we know we have heard from some of our teachers and staff that they have concerns now where there are no students in the building about compliance with the 3 Ws and the governor's executive order, the NCDHHS guidance not necessarily being followed. And that's why it's critical to note here that that is a condition that is important that we all get on board with, and that there be accountability structures in place for those who are not following the guidance and the rules that are expected to safely return to in-person instruction. You can see some of the guidance that has been provided and the things that have been taken care of in this slide around facilities and health. We have COVID-19 coordinators at each school. That's not an extra position. It became a duty on top of what somebody else was doing. We're establishing care centers in schools to handle students that may have symptoms or staff. There's processes, language that has been communicated about handling presumptive, suspected, positive, confirmed cases. We have screening protocols that have been outlined. Some schools have practiced them, some schools have not. I think there's lots of reasons for that. Our teachers are underwater with remote instruction and virtual academy. Carving out time is a difficult thing to do. We just talked to you about how much more they're spending on planning. And we do have another month before the recommendation that the staff is bringing contemplates a return to school. But that is work that is still ongoing and needs to be done. But again, finally, as I said previously, it's that culture of ownership that we have for how we take care of each other that's going to be important, along with the accountability measures that get put in place for when folks are not following the guidance that's required. So next, the third major area that we talked about was staff readiness. And here, ensuring that the health and transition needs of staff were considered and that staff and teachers are as comfortable as possible returning to school. The Plan B transition that we put forth provided that 9 weeks, that first quarter, for employees to return to the classroom or to request long-term work accommodations if that's what they needed to do. In more than half our buildings, at least 3/4 of teachers are now working in classrooms. Almost every vacant position is filled. This does not mean, however, that all teachers that are in the building have resolved all of their concerns about health and safety. And as we add the additional component of students into the building, it is going to be critically important that we continue to seek feedback, listen, and respond to staff about those concerns and provide the learning, the support, the conditions that build their confidence. This is also an opportune time to make a point about our teachers that I think has been lost quite a bit in the debate about reopening. Public education, and by extension, our teachers, are in an extremely difficult position. They're not frontline workers in the sense of a doctor or a hospital employee, but their value to our community is highlighted every single day that this pandemic continues to disrupt the daily routines of our parents and community. While the pressing need for in-person instruction is clear, we have heard from parents and families about how hard this is on them as well. We must also acknowledge the genuine anxieties of teachers and demands that we are placing on them every day. We cannot create a workplace that's free of risk, but I do feel that we are ethically required to do all we can to make schools as safe as possible for a return to in-person instruction, without dismissing or discounting the fact that we are asking teachers to accomplish a task that many of us cannot, and frankly, would probably not even take on ourselves. I believe this point is often lost in the current debate among teachers, parents, administrators, and elected leaders. And I cannot tell you how much it disturbs me to see that debate unfold. No group speaks for all of us, but we really are in this together, and we must be collaborative, not divisive. I would not offer a recommendation that did not meet our goal of safe in-person instruction. But reaching that goal is a tremendous challenge for everyone, parents, administrators, and especially teachers. In fact, I would suggest that what we're asking of teachers is really the hardest of all, not because of safety concerns, but also because we know that what we're going to be able to accomplish in Plan B in this blended approach will not be what many of our students need. It might be better than fully remote for some. Our teachers will be taxed, stressed to meet the needs of multiple cohorts of students, 30% at least. And that must be acknowledged. We also know that in order to come out of remote instruction, where we are now, and move towards daily in-person instruction for all students, when it's permitted and safe to do so, we really must go through Plan B to get to Plan A. We must go through a hybrid rotation that phases students in. You've heard me say this before. There is no good Plan B. It's contrary to our commitment to excellence, our daily mission, and who we are as educators. And yet it is also a responsible and prudent way to phase back into in-person instruction. Our teachers and administrators have worked themselves to exhaustion to make remote learning successful for tens of thousands of children. And I'm sure they will do again what has to be done for Plan B as we move towards returning to fully in-person instruction. But we need to publicly acknowledge that they do not have the resources that are needed to succeed at the levels we know are needed. And that is painful. It's painful to watch them struggle and painful to watch groups blame each other for a situation that none of us control. Schools are not resourced for Plan C or Plan B or even Plan A. And there is no playbook of proven strategies for this pandemic. As we look into the future, I hope that we can agree that resourcing our schools to achieve the level of excellence that our communities expect, our teachers require, and our students deserve will be a priority. This is, in fact, our sixth core belief. The Wake County residents value a strong public school system and will partner to provide the support and resources to fully realize our shared vision, accomplish the mission, and sustain our core beliefs. I'd like to move now into some discussion about the metrics that we started at our last meeting. So when we think about determining whether or not it's safe to return to school, there's the following health guidance are the things that we're looking at. There's the metrics that are available at the state and the local level that we look at on a daily basis. As mentioned earlier, the findings provided by the ABC Science Collaborative have made it clear that compliance with a plan is far more than just a specific metric when determining whether or not schools can operate safely. With that understanding, we're revisiting that information from September 15th. We believe that these metrics, this language is appropriate for how to decide when to safely return to in-person instruction. The North Carolina Department of Health and Human Services and the Wake County Health Department publish metrics that we do monitor daily. And when there are differences in those metrics, we reach out to our local health officials who have advised that the local data that is collected at the state level is where we should pay attention to what we're seeing. We must remain cognizant and sensitive to the state measures and guidance, or our ability to operate safely is in jeopardy. However, we must also acknowledge that there's no single number that defines safe from unsafe. It's not really a matrix that tells exactly when to reopen. It just doesn't exist. The key to operating safely again is found in compliance with the 3 W's. Wear a mask, wait at least 6 feet apart, wash your hand frequently, and a well-defined plan for reentry that allows students and staff the opportunity to practice the protocols, work in the protocols, and then assess them. I'd like to ask, since there's a good bit of information here from the ABC Science Collaborative that we've leaned on, to invite Dr. Benjamin to provide a little bit of background based on how we're approaching the discussion around metrics. Dr. Benjamin?
Sure thing. So based on school reopenings globally, whether that's in the European Union or in Asia, Australia, the United States, or North Carolina, a couple of patterns have emerged. One is that in the low incidence, low rate of positive test results communities, if schools reopen without masking and without distance, that schools can be a nidus for secondary transmission and for additional infections. It's also clear that in communities where the percent positive is greater than the North Carolina average, that failure to adhere to masking and distancing can make things considerably worse. We've seen that in the southeastern United States. And we've seen that with masking and distancing, whether it's here in North Carolina or outside of North Carolina, masking and distancing and hand hygiene predict success for a school and for a school district. There are not strong data around percent positives 4% versus percent positives 6%. So while I think it is thoughtful, I think it's prudent to take into account what's happening at the state level and at the county level with percent positives. It's the reliance on the plan rather than on the percent positives that predicts success in school districts that are succeeding right now in the state of North Carolina. The next thing that I think is important is that paying too close attention to a statewide or county metric can be distracting for managing a infection control situation with something like SARS-CoV-2. By the way, I'm sorry, I'm going to take a tangent here. Whenever I use the word SARS-CoV-2, that's the coronavirus 2 or COVID-19. Those are synonyms. So COVID-19 and SARS-CoV-2. COVID-19, when trying to manage something like COVID-19, if we pay too much attention to a percent positive metric or some other singular or multitude of metrics, we can lose sight of what needs to be done. For example, if there is a cluster or outbreak of infections in a pre-K area at a particular school, increasing the number of positives in this county of Wake County, intervening at that particular school is extremely important rather than shutting down or opening up the entire school district based on what's happening at one school. So the metrics are percent positives, total infected per day, what's going on as far as hospital admissions are concerned, the availability of acute care beds. Those are certainly worthwhile things to keep an eye on, because if the percent positives and the total infected number per day skyrocket to above 10% test positives and above 2,000 and 3,000 and above 4,000 and 5,000 in the state infected per day, we know from experience that hospital bed being filled up with COVID patients will follow. It's a good idea to keep an eye on those, but managing the compliance to good public health principles is where the good public health practices are able to improve outcomes for folks in our community. This as a county entity, needs to partner and collaborate in ways with the state. Other than that, I don't have a strong opinion about the details of how that's done. That's a relationship between the county and the state. The state's certainly giving you some guidance as to their perspective about that. As far as Plan B is concerned, the districts that are succeeding with that are adhering tightly to the masking, the distancing, and the hand hygiene. I do not have data one way or the other on plans other than Plan B. We just don't have data yet on anyone pursuing Plan A.
Thank you, Dr. Benjamin. So just taking a look at what's on the slide, enforcing the 3 W's, learning from what districts who have been in Plan B have done in terms of that hybrid model reentry that has shown some success. Those are cornerstones in how we are looking at what's in the metrics and how we've developed our plan moving forward.
Yeah, I mean, I certainly like that middle column, and the third column, again, I don't have an opinion as to whether or not somebody should go to Plan B or should go to Plan A. But for any school district that's attempting to move forward through this, pursuing a hybrid model first has been associated with success. That way it allows systems and schools and staff and families to adhere to the protocols in a much more controlled environment. And I don't want to take a strong opinion on anything, but and my understanding is what's on the table for you guys is whether or not to go to Plan B. Going straight to Plan A, which my understanding is not on the table. We just haven't seen folks have success with that. What we've seen folks have success with is from remote to hybrid and then reassess. Thanks.
Thank you, sir. Thank you again, Dr. Benjamin. So I want to thank Dr. Benjamin for joining us today. I know he's going to hang on for as long as he can in case there are questions as we come up through the actual presentation of the recommendation, or we could stop here for just a moment if there are any questions that we'd like to engage in at this time. What is your pleasure, Chair Sutton?
If you go ahead with the recommendation and then
Okay.
some questions from there.
Okay. So having reviewed the conditions, the supporting components, the use of metrics, the following slides are going to examine how we can move forward. Based on some of those changes and evolving conditions that we noted in the earlier slides and in response to questions that have been asked, we are suggesting that we have the capacity to offer the following proposal to safely return to in-person instruction. This proposal is not without challenges, and a continued focus on addressing the acknowledged concerns shared by staff and families for any in-person return must continue. So in the proposal, what we are looking at here is beginning in October 26, which we noted earlier was the beginning of second quarter for most of our calendars. We would begin in a 3-week rotation for pre-K through 5th grade and our K-12 regional programs. And we are proposing that grades 6-12 remain in remote at that time. On November 9th, which is 2 weeks later, we are proposing that grades 6 through 12 return in a 3-week rotation. That is the proposal that we are offering. I will say that based on the teacher feedback that's come through and some of the other evolving guidance that we're seeing, staff has contemplated whether or not grades 6 through 12 would remain in remote for a longer period of time, even through the end of first semester. We know that our kids and our families and our teachers want to get back to in-person, but there are some additional logistical barriers with grades 6 through 12 in a 3-week rotation when we come back in that are a little bit greater, and I'll talk more about those in a little bit. And then on November 16th, after a full 3-week rotation of pre-K-5 and K-12 regional programs, staff is proposing that pre-K-5 and K-12 regional programs would return to daily in-person, which is Plan A. So I do think that it's also worth noting here that these recommendations that we're making also have sort of embedded within them our understanding and our knowledge and talking to principals about actual building capacities. We have many different types of buildings in the districts, and the capacity itself varies by grade span. An example that I will give here is our K-3 capacity in classes to social distance is technically greater because those classes are already smaller based on the legislative mandate for K-3 class size. But once we get to grades 4 and higher, we regularly have classes that are over 30 students. And so I think that it's important to understand here that even though just over half of our students are now in virtual academy, that doesn't mean that the other half can just return to in-person instruction and the requirements of social distancing continue to be engaged. And let me explain that. And if half of our students are in virtual academy, then it would stand to reason that about half of our teachers are also in virtual academy. So that and the example I'll give is maybe with a kindergarten class and then maybe move to 4 or 5. So if I'm in a school that has 80 kindergarten students, that's going to be 4 teachers, 20 each. A little above the formula, but it is the maximum that's allowed right now, 20. If 40 of those students, 50% are in virtual academy, then 40 of those students come out of the 80. But of the 4 teachers for those 4 kindergarten classes, 2 of those teachers go with the virtual academy students. That leaves 2 teachers to serve the other 40 students. So when we return in Plan A, that teacher has a full load of 20 students. We may have empty classrooms in the building, but we do not have additional staff to spread those students out into. And that goes to the resourcing issue that I addressed earlier about not really being resourced to address Plan B the way we really want to. So I think that's just important to determine. And then as we get into older grade levels, grades 4 and 5, and especially grades 6 through 12, those class sizes are even larger. Right now, we don't even have an option for grades 6-12 to return in a Plan A. So what we're looking at here with the 3-week rotation for Plan B is the best way that we can ensure the requirements of social distancing 6 feet that are still in place for grades 6 through 12. It's a critical point to remember as we discuss a return to in-person instruction. So I'd like to show you what this looks like kind of in a chart or a graph. So this is pretty easy to understand if you take a look at it. You see the weeks out in front of you. The yellow is the pre-K 5 that we've been talking about. You'll note that that begins October 26th. There'll be one cohort and then a second cohort and a third cohort in those first 3 weeks. And for any student who is pre-K through 5, they would have 1 full week of instruction during one of those 3 weeks. The other 2 would be remote. And then on November 16th, you see the word return going through there. Those would be the weeks that we are proposing here would then begin with full in-person instruction, pre-K through 5th grade and pre-K to 12 regional programs. Below that, you see in the other 2 colors, the proposal for middle and high. You will note that those first 2 weeks of October 26th and November 2nd are not colored at all because those students in 6-12 would remain in remote learning during that time. We are proposing bringing students back 6-12 for a 3-week rotation beginning November 9th. And I don't want you to get confused by the numbers the 3 in that column. The reason the number 3 is all the way down is just simply because we want to make sure that because we paid attention when we divided students early on into the 3 cohorts that we kept siblings together, we would want the week of November 9th when 6-12 returns to be the 3rd rotation that is currently in for elementary so that siblings would be on the same rotation. We sort of left the week of November 23rd out of this, and this calendar is mostly aligned to traditional, some to year-round because they're very close right now. But we left that week out because that's the week of Thanksgiving, where in the traditional calendar right now, the Monday and Tuesday are remote learning days that were required by the legislature. And then we pick back up with November 30th. One of the reasons that we're looking and proposing at starting 6/12 November 9th is that the final week of this, the week of January 11th, which is the last week of the first semester, would need to be incorporated as an exam week for our high school students and any of our middle school students who are taking high school courses. And so then the rest of middle school would be in remote during that period as we prepare for second semester. I think that we need to understand here that as we start looking at rotations of students, and I mentioned this earlier, some of our teachers, 30% at least, will be responsible for technically 3 groups of students. Those that are remote in the rotation, those that are in person in the rotation, and those that might be in virtual academy. It's not the case at every school or every grade level because it does depend on a variety of factors like how the principal has organized their staff to support the students in virtual academy versus those who are Plan B, the size of the classes and the school and how many staff they have available to distribute, and obviously the number of students that are actually in virtual academy. Schools can make changes to reduce the number of teachers teaching multiple groups in some cases, but that will require reorganization. And what I alluded to, I think last time, and our principals have been aware of, where your child's teacher might change in order to organize for this return to in-person. But in some cases, it's going to be unavoidable. I think it'll be harder or it'll be much more frequent, 6/12, but that doesn't mean it won't exist in elementary. And an example I will give you in elementary would be all of the specialists. An art, music, or a PE teacher, most schools have one, would be serving students that are in a rotation, some of which are remote, some of which are in person, and would be serving virtual academy students as well. And that's just, it's a lot to ask. And it's a perfect example of why I say there's no such thing as a good Plan B. So I hope that that visual sort of shows you where we're headed. I do want to remind the board that I said earlier that, another option that staff has considered, it's not in the recommendation, is keeping 6/12 remote longer than what is proposed in the calendar. I look forward to some discussion and thoughts on that. As you look at the plan that now has pre-K5 and K-12 daily regional programs embedded in it, some of the features are that it does align with the option that the governor has provided of returning to a Plan A top option at some point. It does provide an initial runway for pre-K5 by doing the rotation for at least one full set of 3 weeks prior to returning to full in-person. It does provide an opportunity for grades 6/12 to return on 3-week rotation if that's where we choose to go. And that return in smaller groups is really important because it maintains social distancing. It helps us practice the safety protocols and the routines that need to be implemented. And our schools have already prepared schedules based on the Plan B that was adopted that included the 3-week rotations. I've mentioned, and it's bulleted here again, some teachers are really going to have to provide instruction in all of these modalities, and that is going to be a lift. And it's not one that we have an easy answer for. We've got lots of folks working on options and folks calling principals and others to see, if they have ideas about how to lessen that burden and how we can work together collaboratively to address that lift. And that work will obviously continue in earnest as we move forward. On some of our pre-K to 5 bus routes, just like in the classroom, that 6 feet of recommended social distancing will unlikely be met. Because once we increase to daily for those grade levels, that recommended social distancing can't happen in the classroom. It'd be like creating a bubble for the classroom. And similarly, it won't be able to happen in terms of 1 person per seat on a bus. It is not required that we maintain that social distancing, but it is still recommended. So I feel the need to point it out. And sort of embedded in all of this, we've talked about that scheduling and staffing will still continue to present challenges. There are no additional teachers and human resources that are being provided in order to accomplish this. I do want to mention, because a lot of the feedback that we're getting from teachers, and something that I think that I saw in the preliminary draft results of that survey, spoke to asking teachers what would help them and what are some options, in particular when it comes to time, that would help them with all of these competing demands and tasks and this heavy lift that we're asking of them. And one of those things that has come up is the notion of a remote learning asynchronous day that's embedded every week. And staff does plan to recommend building in at least one weekly remote asynchronous support day where there will be no live class instruction, either in person or online. And the reason for this is to acknowledge the lift that our teachers are having to make in terms of these multiple different platforms, and to provide that time for planning and contacting and reaching all students as needed. Until October 26th, we're going to tell our schools that if they want to go ahead and implement something like this, they can do that. And until October 26th, we'll sort of leave it up to each school how and when they build that in. But we are going to manage it differently after October 26th, depending on where the board lands with the plan, so that we have a little bit more consistency with when that is happening. And that would be after in-person instruction begins, so that the asynchronous day would be the same for every school within the instructional calendar. And they will be incorporated where there's not already a scheduled non-instructional day. So we're not talking about work days or holidays or previously scheduled remote learnings. Those remain the same. This is going to be done to address both the concerns of teachers, but also families that have expressed the amount of time that students are spending online during remote learning is just too much. You know, it's really interesting in creating this remote learning model that addresses shortcomings that were communicated to us from the spring. And yet now it has become apparent that everything about online instruction actually takes longer. And it can be frustrating and actually impede learning. So the addition of this remote asynchronous day is consistent with teacher feedback. It's consistent with a lot of the parent feedback we're getting about students needing a break. And it can support the current and future learning needs that we have, whether we are in Plan A, Plan B, or Plan C. So this is a recommendation that we intend to make for all remote instructions in grades 6-12 also, regardless of the final details, and for all remote or in-person or rotation instruction for students in pre-K 5 as well. So I want to spend just a couple of minutes talking about the 2-week rotation, because we did bring that up with staff and parents, and the board asked us about it last time. And this was really predicated upon this notion that because of the fact that 50% of our students were in virtual academy, would that facilitate a 2-week rotation? It does align with what the governor has provided us as option. The 2-week rotation theoretically would provide students with more face-to-face time while we are in the rotation prior to returning to full face-to-face. And it does continue that staggered approach that we've talked about. The 2-week and the 3-week rotation do. However, schools do not have their schedules built on a 2-week rotation. That would be work that they have to do. That's an additional lift that we would be putting on them. Some of these remain the same as they do for the 3-week rotation, and that's the teachers having to work in multiple platforms and multiple cohorts of students. The bus routes would need to be reconfigured for 2 weeks. And then we've talked earlier that the recommended social distancing for pre-K 5 couldn't be accomplished when we go back to Plan A. And we cannot do it for grades 6-12. And we are still required to do it for grades 6-12. So the 2-week rotation, and it doesn't make sense to have pre-K through 5 start in a 3-week rotation and then do 6-12 in a 2-week rotation, and then have kids on those differences there. So that's why we stuck with the 3-week rotation for the recommendation for 6-12. And like I said, we cannot do a 2-week rotation for grades 6-12 and meet the requirements that are currently still in place based on the governor's executive order and North Carolina DHHS guidance. So it's just not doable. So then moving on. So I want to talk a little bit about Virtual Academy as we sort of wind up with after the recommendation here. Virtual Academy is a really important component of choice that we have offered our families in the community. Our current registration for Virtual Academy sits at just over 85,000 students. And we know at this point, as you look through the bullets, it's important to limit changes to the Virtual Academy enrollment at this point to extenuating circumstances. If it becomes a full two-way door open one way and the other, outside of what we've already communicated to families, because we did ask them to commit to a semester or a full year, then we begin negatively impacting the return plans that we have and the rotation plans that we have. It makes that planning sort of start all over again every time that we start adding more students and moving back and forth. We have communicated in our FAQ that students who chose fully online instruction for the entire year may request to return to their classroom setting at the start of second semester. Students who enroll in the WCPSS Virtual Academy for the fall semester only need to remain in the Virtual Academy for the duration of the fall semester. That's what we're saying. Currently, students who do have extenuating circumstances that need or wish to implement a withdrawal from Virtual Academy or an enrollment in Virtual Academy are going to be working through their school-based administrative team on that request. And the principal will need to consider it based on staffing, class size limits, any other considerations that apply to the context at the school level. This is only for extenuating circumstances. I want to repeat that there will be an opportunity prior to the start of second semester for students who chose year-long Virtual Academy to make a decision about whether or not to stay. All students, quite frankly, will be able to make changes to their enrollment in terms of Plan B transition or Virtual Academy for second semester. Students who are currently enrolled in Virtual Academy could choose to extend for the year. Students who are not currently enrolled for the year in Virtual Academy, only a semester, will have the option to attend on Plan B for second semester. And students who are not currently enrolled in Virtual Academy who are Plan B will have the option to enroll in Virtual Academy for second semester. So through the process that we will put in place, and that will likely be end of October, beginning of November-ish, that we will be able to do that. And that will be sort of the timeline for students and families to make changes. We do need to finalize families' decisions by around mid-November in order to ensure that the capacity needs we have, that the staffing that we have, that the building constraints, depending on where we are in our plans and our schedules, that we have the time to plan to be ready for the beginning of second semester. So sort of in summary, as we look at the dark blue box, which is the board adopted framework for Plan B, and then we look at the middle box, which is the light blue box that staff is recommending. Again, a start in October 26th with a 3-week rotation for pre-K5 and K-12 regional programs, where they will remain in that 3-week rotation, 3 weeks, and then November 16th at the bottom, pre-K5 and K-12 regional programs would return to daily in-person instruction. In the middle, we have a recommendation for grades 6 through 12 to begin a 3-week rotation beginning November 9th. Again, I will just point out for the board that there has been considerable discussion about whether or not looking at staying in remote for a longer period, possibly the full semester, for grades 6 through 12 should be considered as well. And then you'll see in the orange box that we have just put an X on it because we cannot do it based on the current guidance and limitations, especially for grades 6-12. So I think with that, I will turn it over to Mr. Sutton to close either now, or do you want to take questions first? I think you're muted, Mr. Sutton.
Okay, yeah, we can begin with questions at this time. Again, you heard the recommendation from superintendent. She also spoke about the challenges faced by both students and parents as well as our teachers. Some want us to return to full face-to-face instruction as soon as possible. Others want us to wait longer until we are sure that it is safe to do so. This board is challenged with trying to balance the risks and benefits of a return to school. And given the recommendation from staff, we will most likely land somewhere in the middle there, it seems. So thank you, Superintendent Moore, and your leadership team for your work and due diligence in bringing this recommendation forward to the board. Board members will begin. Any questions that you may have?
As you get started, Mr. Sutton, I just wanted to let board members know that Dr. Benjamin was called away. So if you have specific questions for him, if you'll just let me know what those are, I will get them to him.
Okay. And board members are going to ask you that you be brief and concise in your questions. And because I'm sure that everyone, as I see the hands coming up, we want to give ample time for all board members to ask their questions, to have adequate responses from staff, and that everybody leaves this meeting prepared and ready to deliberate and make a decision again a week from today. So again, I start with the hands raised. I'll see in order. Dr. Martin, good afternoon to you.
Thank you. And, I appreciate for us all to be brief and concise. At the same time, I also want to acknowledge that there's a lot of work to do here. And, I do feel like we need to make sure all questions actually do get answered. So I appreciate Dr. Benjamin's statements regarding masks and air quality and so on, and I concur with those. I've read a lot of the science myself as well. I wish you were here to confirm. I mean, I think it is an absolutely correct statement that an N95 mask is not necessary for what we're talking about, but I think it's very critical that, and I'd like to hear the system formally acknowledge that we do believe that it is necessary to have a good fitting mask. Cloth masks absolutely work. Medical masks absolutely work. As I've shared with some, NC State provided these medical masks to us at NC State to teach, particularly when we were in person. Well, this medical mask works fine if I'm working in the lab where I'm not talking or talking, a little bit with my students. But this mask simply did not work when I was teaching. When you're teaching, you're talking a lot and your mask moves. And so you spend time readjusting your mask. It comes down, over your nose. And if a mask, it comes down over your nose, your mask does no good. So, I guess that I would like to hear confirmation that we will acknowledge teacher and staff concerns that there must be well-fitting masks, and that, I'd like to hear us acknowledge that we're going to work to help make sure that that happens rather than saying you're just on your own.
So Dr. Martin, a well-fitting mask is important. I've seen the masks that have been delivered to our schools, and they may fit some people better than others. They are a one size type of thing, and that certainly don't all have same size faces. I also know that because we've been under a mask mandate for quite a while in the state, that most folks have their own masks, and it is perfectly acceptable for folks to wear their own masks. I do think that if we run into a situation where the masks that have provided are not well fitting and the staff person is in need of a mask that fits well, we have been provided, the state has been provided additional PPE dollars to purchase additional masks. And I just contacted them earlier today to see, could we choose our vendor for those masks to try to provide some options for the dollars and maybe get some feedback from folks if they know of a type of mask, or if there's a way to do that to facilitate that with any teachers who have a need. Because we absolutely need to provide every staff with a mask that fits well, that gets the job done that we're asking it to do.
Thank you. And I just think it's really important that we communicate to teachers if you have issues, where and how to make those issues known.
Okay.
Thank you. Similarly, again, I completely concur with Dr. Benjamin's discussion about HVAC. There is, pretty clear study on the nature of particles. I think the challenge that, I think it's very important that we do validate the concerns that we've been hearing from a lot of staff working in the buildings, is that I think there is a prevailing assumption, and I would have liked to hear Dr. Benjamin say this as well, that there is a basic framework working HVAC system. And I know we've got some of those challenges in some of our schools. At the same time, I think it would be worthwhile for staff to emphasize the work that has been being done during this building close down time to try to get those in better operating condition. But again, I think it's really important that as a school system, we start with an acknowledgement that it is reasonable to expect a functioning HVAC system. We don't need HEPA filters necessarily, but people should be able to expect a reasonable HVAC system. And again, I think it's really important to validate that concern and let staff know that we've heard it and continue our work to make sure that we have functional systems.
You're right, Dr. Martin. We've asked our facilities and operations department to prioritize this work in our schools, to not only ensure that we are keeping up with the maintenance schedules and changing of filters, but that we are addressing issues that sometimes seem to come up year after year after year, especially in some of our older buildings with older systems. And so, I don't have the full answer to you other than a commitment that we are doing that work and it is a priority for us. And we'll see if I can get our folks to provide a little bit more specifics about what that work is looking like.
Thank you. Like I said, I think it's just important to recognize that this is a valid concern. There are, we don't need to go to the extreme, but we do need to have functional systems, and that is a legitimate concern of teachers. Now, more of a question. I appreciate you adding the statement that there will be consequences and accountability. That has been a question that I have been asking for some time. It was in one of my questions submitted to the board that for whatever reason, none of my questions, issues of concerns made it into the FAQ document. I don't quite understand why that happened. But, as Dr. Benjamin said, we can do this if compliance is high. We, as you noted, are already getting many reports where compliance is not happening. So I haven't had a chance to look today, but as recently as yesterday, I was looking through documents and I've not been able to find descriptions of the consequences or the accountability structure. When is that going to be available? Where can people go to look at it? I think it's very critical that accountability structures be communicated ahead of time, both for staff, because, like is noted, one of the biggest challenges is when staff don't follow protocol. But I think it's very important that the community know that coming back to in-person in whatever format is a privilege. It's not a guaranteed right. And I think that we need to be very clear in our accountability, and I hope our structures show that. That's why I'm looking forward to seeing that, coming back is under the assumption that you will agree to compliance to our policies. And if not, we're not kicking you out of school, but the virtual option is there because we can't afford to have non-compliance in our systems. So I guess my question is, where can we find the information on the consequences and the accountability structures?
So I need to touch base with AJ because I know that that's a staff document that he's working on because it's pretty operational in terms of how we're communicating with our principals and our schools about it. I know that it's a work in progress. I'm not sure that it's done yet, but we've been reviewing drafts of it. And then our Student Support Services Department with Paul Coe has been reviewing what that looks like for student compliance. So I can check with them to ask them to either, I don't know if either one of them is on and can provide any guidance of where we are right now with it, or make sure that I get to you what they're working on. But I do know that it's contemplated not just for staff compliance, but student compliance as well. Because as you said, Dr. Martin, it is critically important that we are in compliance with these, that these are not recommendations, that these are rules, and that they demonstrate that we care about each other and that we know that, as Dr. Benjamin has said, these are the things that make the difference. So I'll leave it open.
Yes. So Superintendent Moore, thanks for passing that along. And Dr. Martin, thanks for that question. I just wanted to note that we've been thinking about this for a while, ever since schools closed, but knowing that with the governor's announcement, we know that guidance has to be finalized and developed. So there's a team of us together thinking through the need for clarity, consistency, and alignment on the 3 W's to make sure that we reiterate that, and that we are providing guidance that has clear ways to set the right conditions so that students have a great understanding of the need to comply with the 3 W's out of care for each other, but also what are the clear consequences and the procedures around the consequences that will make sure that students who maybe are choosing to not be compliant, that we respond appropriately and that there's clarity around that. And so we are meeting early next week to continue drafting it, and we'll get a final guidance out ready to be sent out to schools shortly.
And I can add from the employee side, Dr. Martin and Shko, thank you for that. We have rolled out lots of training and expectations, obviously, for employees around the importance. We have also communicated with supervisors some steps that they can take to handle issues of noncompliance. And like all of the rules we have within the system, sometimes those instances can be handled at the school level, and sometimes it does need the involvement of human resources. So we've let supervisors know that we are available in human resources as well to support that. And we are looking at a version of that guidance that we can also communicate to all employees so they know the seriousness, as well as there is accountability for not following them.
And I appreciate that. I mean, this is one of the policy issues I raised way back, in March or April, that we needed to start working on. Because of the importance of this. I mean, and Dr. Benjamin basically made that absolutely clear, that the success or not is completely dependent on the compliance. So I see this as an extremely high priority. I am concerned that we may be asked to vote on a plan when this potentially most important component of the plan, we're at least now to the stage we're saying that it needs to be there. But, this is something that, I will just reiterate, this is potentially my most important factor that needs to be considered, and it needs to be effective. We have had settings where, children have been excluded from classrooms a little bit too quickly and too easily. We need to understand situations. We need to make sure we're paying attention, and we don't, create one more situation where we get, racial or economic disparities. So we need to be very thoughtful in our plan, but it is extremely important to me that there is a clearly articulated accountability structure, both for families and for staff. So I'll look forward to seeing whatever comes from that.
So could someone help me understand what a reasonable consequence might be for both a student and an adult or teacher if they don't have a mask, forgot their mask, the strap around the ear broke on my mask? I mean, what would be a reasonable consequence?
Thank you, Keith. I certainly have that. This is Johnson Hosler at the top of my list, which I'm sure you all know. I'm hoping it's a strength-based response, but I do appreciate you asking that without us moving forward and losing that.
Mr. Sutton, so for us, what I could say is that we're still in discussion about what are the appropriate consequences, but I think the thing that we want to emphasize is that we want to be proactive in helping our students and family understand the importance of why do the masks need to be worn in service of both individual safety, but the collective safety of the community. And I think in terms of consequences, we still have to think that out around with both legal guidance and with the policies that we have in place to make sure that we are not creating a situation where we go from 0 to 100 and suddenly there's exclusionary practices just being put in place.
Well, I guess I'm trying to understand our response to that and what Dr. Martin's expectation is of a consequence, because again, I would not want to see any disparate or disproportionate consequences being handed down to students who, some students may only have one mask. And if I forgot that mask, it fell out of my pocket. it broke, it's soiled.
Well, please note, I raised that we need to make sure that we don't create disparities. You know, again, I've lived through this. I was given a stash of masks and was told to bring them to every class that I teach. And so that if a student had any of the situations that you all have raised, it was my responsibility to provide this to the student. I would expect we would do the same thing. Yeah. But the issue is not for the student who, you know, wants to comply and has any of the issues that you have raised. But I think our issue is, you know, sort of a willful refusal to comply. That's where I think the biggest issue is. We can help by offering the mask. We can help by trying to find out whatever situations otherwise are going on. I think our issue is, what do we do with the active refusal to comply?
And Dr. Martin, I think that's part of the guidance we are currently drafting and developing. And once we have that ready, we'll make sure that it's brought to to the board for review.
And I think from the employee standpoint, between Dr. Martin and Chair Sutton, you, I think, have brought up 3 different instances of an employee who may not be wearing a mask. You know, a willful refusal, I forgot, versus, you know, a strap is broken. And I think what we need to do is obviously look at all of those in context, and we want to try to help the person who maybe forgot or has something that's broken come into compliance. Whereas a willful refusal could result in, you know, more serious consequences, not only at the school level, but at the HR level. You know we can't put an employee who doesn't have a face covering around students and other employees. So, you know, when it comes to HR, there might be serious steps we have to take to ensure that the employee is not in that school building.
And Mr. Sutton,
to do that.
And Mr. Sutton, just to add one more response, is that there's a situation where a student doesn't have a mask available or a strap broke, there will be masks available for students at the school as well.
All right, 2 more questions that are, the 2 are somewhat related. You know, a big issue, obviously, that I have is, you know, the time and the expectations on a teacher. I appreciate, Superintendent Moore, your comments, recognizing the challenges, recognizing the extra work, and I think teachers will appreciate having heard that. At the same time, and I also want to absolutely applaud the idea of the asynchronous day for both in-person and remote. I think it is important for us to make sure we pay attention that asynchronous does not mean just not live instruction, but still electronic. We need to make sure we're focusing on offline opportunities for that asynchronous component. But I highly applaud that is one sort of, you know, taking some things off the teacher's plate. But any of us who think about the practicality of making this work know that the time is going to go up. And we already have teachers, 50% are indicating that they are spending 10 or more additional hours. So if you think about a 40-hour work week, that's an extra 25% of your work week that they're already spending. And so I guess my question is, when and how are we going to recognize that expectations that we're putting on teachers is simply too much to be possible? The statement that I heard sort of is recognizing that it's going to be incredibly difficult, but at some level, you know, we're just going to, it feels to me like, and I believe that many will hear this as, you're just going to have to figure out a way to make it happen. But I guess what I'm asking from a system perspective is, when and how will we recognize that we've got to say, okay, enough?
I'm not sure that is, you can contemplate an answer unless I'm not sure if what you're proposing is stay in remote learning and not do anything until everybody can go to plan A. I'm not sure what you're proposing in terms of, is if it's acknowledging how difficult this is, it is. I've had several folks from leadership talk to principals, and you've got principals that are all over the place on, we can figure this out, we will do it. Teachers that we can figure this out and we will do it. Other teachers that have no idea how I'm going to do it. We internally understand how challenging this is, and we're all over the place with it, and it's completely different, and we're not going to know what it is until we get into it. But I'm not sure if what you're contemplating when you ask that question has an alternative associated with it.
Well, I mean, this is part of why, I feel like, there needs to be, more. I'm not at all trying to minimize the work that's been done, and no, I'm not trying to say stay in remote instruction. My evaluatory tool is: are things safe? Are they achievable? I say, are they funded? And really, what I'm talking about there is, can a program operate without the requirement of volunteer labor or unpaid labor? And is it effective, right? Those are my criteria for looking at this. And so, I hear you that we can't necessarily know until we try. And there's aspects that absolutely needs to be going forward. But what I'm asking for is, there needs to be something between don't even try and damn the torpedoes full speed ahead. There needs to be some point where we're looking at it, at things and saying, okay, we can't do it unless we have additional staff. Maybe we have to reorganize, even central office, just like, we move nutrition workers into running some of the FAST programs. I mean, do we need to reorganize staff? I guess related to that maybe is my question, particularly since at least K-5 we're looking at a path to Plan A. I'm concerned because we have several, particularly 4 or 5 classes, that in order to accommodate the K-3 class size legislation have gone to 30 plus students. And yet we're also working under the governor and health department's recommendation that congregate gatherings should not be more than 25. So if we looked at, and we said, look, we can't have rooms with more than 25 people in the classroom. How many additional staff would that require? Do we have staff that we could reassign to meet that need? Or are we just going to take our existing teaching workforce and saying, somehow you all have to figure it out? I mean, right now we have roughly 10,000 teachers and 10,000 other employees. There's going to have to be some distribution of labor. Lots of people are working hard. I understand that. I guess I'm just asking for, how are we going to look at things and figure out when and how to direct a redistribution of labor? Or do we go to our county and say, we need some more of this rainy day fund? I don't know where we would hire people, so I think it's going to have to mainly be redistribution of responsibilities. But how are we going to keep it so that we really should not have congregate gatherings in classrooms over 25 people?
Dr. Martin, I'm just going to add that Superintendent Moore is right. Over the past few days, we have been reaching out to schools, and I've talked to probably 10 plus principals in the past 2 days, and I've asked some of the very questions that you're asking now, and it's not going to be easy. But when I talk with principals, they tell me that obviously the asynchronous day is going to help.
Huge benefit, thank you.
They are working with their PLTs as well, and they are being flexible. For instance, they may have to make some schedule adjustments, or within PLTs, certain teachers may take on more of the virtual or more remote, while another group of teachers works with the in-class students. A principal I talked to this morning, the all subject teachers have common planning time, and so they are working already to start to think about what that will look like when students return. That's not more staff, but it is thinking how we can reassign within a school, how we can shift scheduling, how they can do some things different. Centrally, we have talked about, particularly because we know it could be problematic with singletons, we have discussed organizing meetings with some singletons like dance teachers, music teachers, art teachers, CTE teachers, to start to figure out what we can do to be supportive. Some of them already have figured out some things. I was talking with the principal and hearing some work about what their dance teacher is already doing, which was some great ideas that need to be shared with other teachers. And so I think that's something that we can do. There are some best practices out there. There's some folks who have figured this out, and we need to reach out and make sure that we sort of spread that well. So we are going to be working diligently to make sure that we are making those connections.
And again, I do appreciate that. I would be very interested to know what it would take in terms of staffing to make sure that we don't have any classes that exceed the 25-member congregate gathering. And we did that when we looked at the K-12, the K-3 mandate. And I really think that we need to consider that again here, because there's plenty of risk that we're asking teachers and frankly fellow students to deal with. And if we're putting more than 25 people into a single room, I'm concerned that is adding risk that we should not be adding. So, all right, I will end my questions there.
Right, we can pull that information, Dr. Martin, and see how that looks across the district, in grades 4 and 5 in particular, which is what we're contemplating here.
Exactly, that's where we need to start.
Thank you, Mrs. Mahaffey.
Thank you, Chair Sutton. Superintendent Moore, if you would clarify, because we have multi-track schools, and our assumption was with a plan A that they would recast over their tracks. Does this assume that our elementary schools stay on track 4 only?
We're going to need to keep our multi-track year-round schools on a single track through at least the end of the first semester, and see how that goes. And this is again related to staffing and how people have been divided, because to then have to try to divide across tracks and return to it would also complicate the resourcing issues. So yes, they would remain as is on that single track calendar at least through the end of the first semester.
Okay, thank you. I do have some concerns on crowding. We know that the K-3 class size mandate had a significant impact on our 4th and 5th grade classrooms and what those look like. And we haven't fully phased in. So some of our 3rd grades can be at 20, 21 kids per class. And our 4th and 5th grade, our older students are more likely to be in mobile classrooms, which are generally smaller than classrooms that we find in the building. And I wanted to ask, and knowing this is not ideal, but has staff explored crowding issues within our multi-track year-round schools, with every student being in on a plan A? And had they explored looking at maybe having pre-K 2 once that full rotate through on a plan A, and 3-5 continuing on a plan B rotation? I know I asked this, well, it would impact my own family, but I'm trying to see what would work in our schools, because I do have concerns about crowding, especially in our higher elementary grade levels.
So I think it's important to note that generally speaking, the distribution of students who chose Virtual Academy is not that different from one school or area of the county. There's a few outliers, but it's about 50% or so at most schools. So I think there is space in the multi-track year-round schools to accommodate those who remain on Plan B on a single track in the classrooms. I think the K-3 class sizes will be smaller because they're already smaller. And the 4th and 5th, as Dr. Martin has pointed out, is where you're going to have to pay attention to how many kids are in the room. And if we wanted to set a cap or something, and we had both the dollars and the people to apply additional resources, could we do it? But I think that currently for first semester, based on the fact of the number of the students that have chosen virtual academy, there is space in our multi-track year-round schools to accommodate those that would be on Plan B.
Okay, is there a possibility, I mean, that we could get our facilities team to look into that?
Confirmation. I'll get you confirmation.
I mean, I've been in some of those trailers, and I know, having the crowding that we have in our buildings normally, it's just, I'm trying to picture it.
Right.
And I know, the larger class sizes in 4th and 5th have been a concern.
Yeah.
Where we've had up to 35 kids in a class.
I do think related to that also is the possibility of spaces that are now open in the building that weren't open before, at least for the first semester. So we will confirm.
Okay.
Thanks.
Thank you, Ms. Mahaffey. Ms. Kushner.
Good afternoon, and thank you all. This is Mark and Superintendent Moore. Thank you for your opening comments. They were pitch perfect, and I appreciate you acknowledging the messiness and imperfection that we're faced with in making these decisions going forward. So thank you for that. And to all our principals and teachers who have given feedback, it's critically important that we hear that feedback and we adjust and pivot. And particularly our principals are going to be the linchpin, as Dr. Martin has pointed out, the importance of accountability and compliance. One of the most powerful things I heard in one of the webinars from the ABC group was that in other districts that have been successful, they have 99% compliance in their general student population with masking. That is an important goal for us to have, that near perfect compliance, and our principals are going to be the linchpins for that, as well as the other social distancing and the hand washing. And I know that I share the concerns Dr. Martin and Ms. Mahaffey expressed about the 4th and 5th grades and our ability to social distance. I think looking at the virtual academy statistics, some schools might be able to handle that and some may not. So I'll await confirmation from facilities as how we can handle that. But that was one of the concerns I was going to raise today, as well as the phase in for our regional programs in pre-K. I think there are some families that may prefer to remain remote in our pre-K programs. And I think that is something we should encourage our buildings to consider if that is possible for some of those families. I'm looking over my questions. I don't want to, I want to be brief, Chair Sutton. But I also want to express some concerns about the calendar with Thanksgiving break. There have been spikes after holidays. So I didn't know if staff had looked at what modifications and if that remote learning for that week was taken so that we can encourage our families to be cautious when they're traveling, because we're going to need our community support once we open schools to keep them open. So what strategies are we going to have to get that community support and give our families the tools so that they can protect the communities that we're forming in our schools to stay safe?
I'm sorry, you were breaking up there towards the end.
All right, just if we have some strategies that we're going to put in place so that we can keep our schools open. You know, this is going to be, we're going to need community support. We're going to need our families to adhere to the protocols in their own homes as well, because we want to make sure that we're keeping our community protected. So I know we talked about webinars for students, and that would be one question I'd have for Dr. Benjamin and the ABC.
Okay.
If they're going to do webinars specifically for our families and our students. Maybe that's the more way to ask it.
Well, I do think that the website will be accessible to anyone. So the webinars will be available. And we have talked to the ABC Science Collaborative about messages, webinars, or something that would be appropriate for students. We already have some schools that are the kids are taking that plan on their own and creating things for their fellow students around how important following the 3 W's is. And that's really, really cool to see, quite frankly. And then, to your point about what may happen with metrics or things that may change in the community, the language and the stuff that we have around handling and presumptive cases, and then how we determine whether or not a section of a building closes or a classroom or an entire school is contemplated in the North Carolina DHHS guidance for reopening schools. And any of those types of decisions would be made in collaboration with local health officials.
And I think that's going to be critical to communicate that with families and teachers, so that teachers can have the confidence that we have those protocols in place. Because I do appreciate that Dr. Benjamin and other and you, Superintendent Moore, and others have addressed some of the concerns that we've heard from our educators, from our principals. Because we have to have those protocols in place. We have to have confidence that they have confidence in the protocols, and that we're going to be doing all we can to reduce risk in the building. So with that, I'll end my questions. Chair Sutton, thank you.
Thank you, Mrs. Kushner. Mrs. Scott.
Thank you, Chair Sutton. Thank you to Superintendent Moore, to my colleagues for their questions as well, and to everyone who's worked so hard to get us to where we are right now. I'm curious about how lunch procedures will look for schools, since that obviously is a period of time when people will have to take off their masks.
I think that in looking at I'm just looking to see in looking at the guidance that's been in place already, our cafeteria staff, Paul Zaluka, is reaching out to schools about whether or not, one option certainly is in person in the classroom eating of lunches, so that in that sense, it maintains the bubble in the classroom, right? If a school were able to use a cafeteria, they would need to take some steps to either keep those bubbles together, or even separate them there, which reduces the capacity of the cafeteria as well. I think that the ability to eat in a classroom is likely going to be a go-to for a lot of our schools, simply because it maintains the bubble. They're in the classroom. Whatever level of social distancing is already happening can continue to happen in there. And there are some additional costs associated with that in terms of how we're able to, whether it's take money or if kids have a lunch account or trash in the classroom. I mean, all of those are contemplated as a part of possibly needing to do this. We will not use the full capacity in our cafeterias at this point. We are not able to. So, most of those modifications would happen to likely being in the classroom. And there's, I'll say it again, this is another aspect where there's no good plan B option here. But
Ms. Moore, Don Hayden here. Let me just add that the CNS supervisors have already met with the cafeteria managers at each school, and they've developed a plan for each school. Whether it be eat in the classroom, setting up kiosks in the hallway, eating in the cafeteria, whatever. All this in addition to the curbside service that will continue to be provided as well. So there are school-specific plans that have been laid out.
Okay, that's good to hear, because I'm sure that information hasn't been able to been shared with employees yet, because I've been asked by more than one school employee about that. So I'm sure that just hasn't been relayed. There's so much information. There's so much to go on, but that's good to hear. And I was hoping to be able to ask Dr. Benjamin about that, because obviously there are schools that have been in session and they have had different lunch plans in place. And from my own, anecdotal questions to friends who teach in other parts of the country. I've heard things from having lunch in the gym and they sit in the bleachers spread apart. So I know there are different options. So I'm glad to hear that each school does have a plan in place. I appreciate that. Ms. Kushner asked the question about, will there be an opportunity for pre-K to be virtual? We know that can be challenging, but it is something that is a possibility. So I do hope that we can take that into consideration. Where are we with special education transportation in terms of vendors and students who have IEPs that call for special education? How has that? I've asked that several times and I haven't received an answer to that. Could someone speak to that, please?
Don, do you have any information from Bob? I don't see him on. Oh, there, Bob is on. Wait, I do see Bob.
Yes, ma'am. Thank you, Ms. Scott, for that question. Yeah, so we are looking at the special needs transportation. Obviously, we're surveying our vendors to get a feel for how many drivers and vehicles they believe they're going to be able to provide with a restart. And right now, those numbers are looking pretty good. In fact, they're real close to where we left off in March. So I think that is that's working in our favor. We also had about 30% of our special needs riders choose Virtual Academy. So the numbers are down in that area also. So we're looking at, the feasibility of bringing pre-K through 5 back on those vehicles, along with all regional programs, and trying to match all of that up at this time. But at this point, all indications are that the numbers seem to be working.
That's great. I appreciate that update, and I'm very glad to hear that. The other concern I have, I've expressed this more than once, and I have to say it again. Thank you, Mr. Sneidmiller. I appreciate that. The other concern I have is having something in place for employees to be able to report anonymously concerns about compliance. And this goes along, Dr. Martin spoke at length about this, where we're concerned about somebody's not wearing their mask or someone's taking it off. And I believe this is such a sensitive nature. I know for a number of reasons we like to discourage anonymous reporting, but I do believe this is a time where something like that needs to be in place. I strongly feel that people need to be able to report their concerns and not at the same time, fear about either, revenge or losing their job or being, that person. I really strongly feel that we should have something in place where those concerns can be reported by employees and family members as well. And the last question I had is, we're looking at the phase-in of students rotating in. Our early college high schools, modified high schools have different schedules for exams. Their exams actually will happen prior to that December break. How would that work? Obviously, they can't have exams, with cohorts working remotely. How is that being considered?
I'm going to see if Drew is on, if he's had any conversations with principals or either him or Brian Pittman that can provide some guidance on that.
Yes, ma'am, and thank you for the question, Ms. Scott. I think, first of all, I think the short answer, Ms. Scott, is that there will be some variance across calendars, and I think what you see on the slide as far as the start date to phase in the 3 cohort rotation, that'll be a common start date across calendars. But what that'll mean, Ms. Scott, is that we will have to make some adjustments for each individual calendar, such that it's possible that all students won't go through the same number of cohort rotations as the traditional calendar indicates. There will be some adjustments, as you just referenced, for example, with the leadership academies, with the modified year-round calendar. And so we would make those adjustments based on what their calendars call for
to allow them to be able to finish their semester as is indicated on the calendar prior to the holiday break.
Okay, thank you, Mr. Cook. I appreciate that. Those were the questions that I had, Chair Sutton. Thank you again to everybody.
Thank you, Mrs. Scott. Mrs. Cash.
Sorry about that. Thank you so much. First I want to say I've got a few remarks. I promise not to be too long, but Superintendent Moore, I really want to thank you. It was a really clear presentation, I think, and I think you did, and the staff, you've done a really good job of answering all the questions that the board had asked you up till now. So thank you. That was a hard job. So I appreciate this. Seems very clear. I too would also like to recognize the teachers, but I have to say I have to say something about principals too, because I know principals are working very, very hard out there and spending hours and hours and days and weekends and nights. So I want to thank them as well. So as you know, I spoke a lot about too, but I want to say a few things about that, and then I'll temper those a little bit. But so if I had my way, which I don't, I would actually prefer that the K2 come in full time sooner than what we're bringing them in. I just think their ability to work on a computer is slight, and they are just learning to read. So it's been really hard for K2 kids. I'm really concerned about gardeners. This is their first impression of the school day. And at this age, they are so totally trusting. And so their experience is kind of embedded. I also think that kindergartners are learning things, or all young kids are learning things more than just things on a computer. They learn how to share, they learn how to participate. Some are needing encouragement to participate. They learn to relate with each other, and they learn to take. They learn to stand in line, even if it's social distancing. It's at least a line they're learning to stand in. So I also understand that the K1, 2, and all the grades will not look the same when they come back into the classroom. And I'm sad about that. So I know that nobody will get the full impact of what school used to look like right away. But I do think first impressions of a school should not just be teachers on a screen. And so I am worried about the K1, 2 grades. And having said that, I'm seeing that a lot of our schools, this is my concern, a lot of our schools are doing elementary different school you go to. Most are taking a team approach in kindergarten, first grade, and second. Not all of them, a few of them aren't. So in those schools, you can actually ask a kindergartner or a first grader or even a second grader who their teacher is, and they will actually say they don't know. So I'm worried about the team approach on virtual learning in those schools. And I think the majority are doing that. In K1, 2, a lot of those kids don't even know who their teacher is. So that bothers me on first impressions of the classroom. So having said, I realize that there's a lot at stake on both sides of the argument. And I've really enjoyed listening to Dr. Benjamin talk. I respect him a lot. He's got a lot of knowledge, and I'm really glad we have him speaking with us. So I'm understanding what he's saying about transition. Don't love that for the little kids. I'm listening. If we are actually, Superintendent Moore and staff, if we are actually going to stay on this for a while for the kindergarten, first, second, I think it's pretty urgent. And Mr. Cook and I about this, and he's done a really good job of reaching out to Kim Keith with the YMCA, who does their learning programs over there. But I think it's now for K2 in our daycare centers and especially the YMCA. So for many reasons, the YMCA FAST just needs something that where all the younger kids will actually go in and finish up at about the same time, so they have more free time rather than waiting for all the other classes to stop and then end up really not getting free time until they go into after school care. That's a long time for little kids to sit at a computer. So I am asking that we look into that like now to see if we can change how we do kindergarten at the FAST program. So the kids are not sitting in front of a computer. They're not, and so they have to wait for all the kids to get done. So if we can work on that, I'd like to hear about that on our next board meeting Tuesday before the vote. That will make a big difference on a lot of how I feel about keeping little kids online for as long as we're talking about in this plan. So I also would like to echo Ms. Kushner's plea. What did I hear something about the to families? I think that if our families that want to come back to school, and I support that, they want to come back to school, I want them, I'm going to ask them personally and very passionately to please start practicing the 3 W's in your home so that when the kids sit back, they're not confused. They totally understand what's expected of them. It will help us stay in school longer if the kids know what they're expected to do from home. And so I do thank you, Ms. Kushner, for bringing that up. I also want to thank, I do think grades 4 and 5, I want to mention, I do think our grades 4 and 5 are going to be very crowded. I think we need to come up with a plan with that, and it probably will be extra resources that maybe us as board members, we need to go out and clamor about, because I think extra teachers are going to be needed in those grade levels. How we get that might be up to us. So I would like to ask my colleagues to consider talking about that. And then again, I was not aware, and thank you, Ms. Scott, for bringing this up. I was actually not aware about the pre-K not having computers and not being online. So we've had a lot of emails just recently about our pre-K kids not having any virtual experience. So you could bring us some facts on that at the Tuesday board meeting as well.
Okay.
So having said all that, I appreciate the time.
And Ms. Cash, I just want to capture what you started out with in terms of our partnership with the Y and the FAST program. I mean, I saw that Drew piped in, so I didn't know if he had an update, but just if I want to capture it correctly, you want to look to see what can be done right away or is being done to support the fact that because the kids that are in the FAST programs facilitated by the Y have different elementary schools and are on different schedules, it makes it very difficult for the Y to not basically have the entire day spent with kids online, rather than being able to provide for all students breaks as needed, given the multiple schedules that they may be juggling.
Exactly. And I know Kim Keith had said that being a kindergartner teacher in her past, she said she would love to do kindergarten centers or first grade centers for a couple reasons. Number one, you know, if we can get our classes to those kids finishing at noon, they have the afternoon to play, and the same with the first graders. But in addition, having K1, 2 children in the same room with 3, 4, 5 has become a little problematic from what I hear.
Okay. And that, if Drew, if you want to add anything, go ahead. Or
Yes, ma'am. And Ms. Cash, I thank you for the question and the follow-up. I have had an initial conversation earlier this week with the Y, and as a follow-up to our conversation that you and I had, Ms. Cash, late last week on this subject. And I can tell you, we'll continue to work collaborative with them to see where we can, work together to provide instructional supports to kids. And as you and I discussed, we recognize there's some inherent challenges with systemically looking to condense schedules, for example, into the AM for all schools and for all kindergarten students. But that's something that we'll continue to explore, and I think we'll probably have additional information to share with you at the next board meeting per your request.
Thank you, Mr. Cook. You were very responsive on that in the very beginning, and I appreciate you making those calls right away. Thank you. That's it.
All right. Thank you, Mrs. Cash. Mr. Haggerty.
Thank you, Mr. Sutton. Really quickly before we go, though, I'd need to go back to Ms. Cash and something she just said. I need a little bit of clarification, if I could, please.
Sir.
I heard you say that you want to spend time at the next meeting discussing where to get more money and that we would put that money in grades 4 and 5?
I absolutely didn't say we're going to discuss it next time. I can't.
Okay.
To get a little more active and how to get funding for extra teachers. So that could be calling legislators or calling anybody, but that, and you know everybody there, so you can. But no, I don't think we should talk about it at the next meeting. I'm just kind of challenging us to see what we can do about resources for teaching positions.
Okay.
It's probably pie in the sky, but
I just wanted to clarify that because, as you know, you've been on the board, before, you've been on the board now. We've got a lot of needs, and I know that those positions for 4 and 5 are important, but I think there's also other needs for our special ed programs, for our children that have IEPs and 504s, and other special services too. So I wanted, and I appreciate that clarification. Thanks.
Okay, thank you. All positions, we can get more.
Okay. Thank you. So, Mr. Sutton, very quickly, I wanted to first thank staff. I know that we presented them with a lot of questions in advance of the meeting. I appreciate that they were able to get Dr. Benjamin to address a number of those concerns as part of the presentation. And the points that have been raised that weren't part of today's presentation, I've seen have been answered and posted by the staff. And so there were a lot of important points there that were addressed. And yeah, I appreciate that. There's a couple things that questions I did have, mostly in follow-up to what we've heard today, and I'll be brief with them. The first thing was Ms. Kushner and Ms. Scott both brought up pre-K, but I didn't hear a response from staff. And I'd like to ask, we hear about an urgent demand for in-person pre-K service, and then we also hear about health concerns about pre-K service. And my understanding was that pre-K is not currently being offered virtually. And I know there's challenges to offering it virtually. And so as we decide on a plan to vote on next week, I just need to know, is it something that can be done? Is it something that can't be done? Or is it something that you're still exploring?
I'm going to check and see if Karen is online and can provide some background on what that's looking like right now.
Okay.
Yes, I just joined or unmuted. I've been here. So, Mr. Haggerty, thank you for that question. I think there's two pieces in that. So right now we are in online services as a district. And while we are in online services, pre-K students are receiving services remotely.
Okay.
What we have not provided, and we have done so out of guidance from our partners at the State Department and folks who work with preschool students, is we have not provided an option for virtual academy for preschool students. There's a preponderance of research that indicates that online learning for students at such a young age, is not good for them developmentally. It's not as effective as we would think it would be. We can certainly reconsider that if the board would desire us to do so, but to commit to that as a district, I would wonder if we are saying that we endorse that when in fact we as staff don't think that's a good option for young children.
And is that one of the reasons why pre-K has been targeted as one of the grades we want to bring back earlier?
Yes, it is.
Absolutely.
If we had a situation where staff had a health problem where they couldn't come in, would there be attempts to try to find alternate assignment for them?
We're actually working through that right now. I think you know that Dawn Dawson leads that work and does a remarkable job with it. She is going through rosters and school by school to determine what staff have been granted accommodations. And I think we are finding that we have a number of staff that have been granted accommodations, and we are working to see how that's going to impact having enough teachers in pre-K. But we certainly are taking a look at that, both in terms of providing options for for teachers who have requested those accommodations and to make sure that we can actually provide services when we are once again in person.
Great. I appreciate that. Thank you, Ms. Hamilton.
Certainly.
Another question, and this was something that I think maybe Mr. Fletcher had asked in his comments to staff, but then I didn't, in the written comments, I needed a little explanation of the answer when we talked about bell schedules. I know he had asked about bell schedules, and one of the things that was contemplated was that there wouldn't be a difference between you going from Plan B transition to a Plan B or a Plan A. We would keep the same bell schedule. I think that was the staff answer. Or
so I can speak quickly, I think, to this, and Mr. Schneidmiller can confirm, but I think that the notion is it is possible that during remote learning, schools have modified what their adopted bell schedule is, but we would need to return to their adopted bell schedule once we began in-person instruction.
Okay, thank you. I appreciate that clarification. And then similarly, if we go to a system where we do have students that are attending class face-to-face and other students in other cohorts, what sort of expectations should parents have about, and they're not tracked out, but the out of cohort students, what sort of expectations should they have about, would instruction be similar to what they're doing now in remote instruction? Would it be something different? Would it be more independent work? What would that look like?
So Drew might need to answer this a little bit, but how would instruction for students who are in the rotation look different than it is now that they are in fully remote?
Yes.
Yeah, and I'll take a stab at that, Mr. Haggerty. I think as the board well knows, this is a difficult question, and it's one I think that first, there's not a simple answer. There will be some variance from school to school, and even in some cases, depending on how PLTs have structured and will structure their instructional plans within a grade level or a content area, there could even be some variance in what that off cohort time or remote time looks like for students. I think that we, and Dr. Martin alluded to this earlier, and Dr. McFarland, responded with some of the structures that we'll work to put in place. I think from a purely instructional perspective, quite frankly, and I think the feedback that we've gotten from our teachers backs this up to some degree, it may be more of a challenge to be in a blended environment where we're toggling back and forth between both in-person and virtual, than as challenging as it has been, the work that our teachers and students have been engaged in a purely online environment. And so I think we can expect there to be challenges. I think there will be some differences, Mr. Haggerty, in the experience of students who have become accustomed perhaps to a routine in a 100% virtual environment that will by nature have to shift and be adjusted to some degree to accommodate a transition to some type of a blended model in a 3 cohort rotation, for example. And I think that's another reason and rationale, again, backed up by the feedback I think that our board has heard, that we have heard from teachers, from parents, from students, about the need to provide some additional time, as small as it may be, to provide those opportunities, not just for teacher planning, which is obviously at a premium given the time that they're committed already, but also for students to be able to access to their teachers when they're out working remotely and that kind of thing. So we see that as beneficial in a lot of areas, but I think it's safe to say there will be some adjustments and differences that we can expect from an instructional standpoint if and when we do move to some type of a rotation model.
And I appreciate that, Mr. Cook. Thank you, because I know, one thing that everybody wants to know, everyone wants more certainty. Everyone wants a better, clear picture of what things will look like. We may not be able to give them a complete answer, but everything we can do to let them see that is important. That's why, again, one of the things that I would like to see us do, but I don't know if we can do, is that when we reopen the window for Virtual Academy and we ask the Virtual Academy of students if they'd like to return to face-to-face instruction, or if there are any, Plan B students that would like to return, that would like to go into Virtual Academy for the spring, if there's a way to just hold that decision until everyone's had a chance to experience at least 1 week of the rotation in, and I looked at the calendars. It looks like you could get maybe two of the weeks in, but then you have the Thanksgiving break. So I know it's problematic, but I hate for families to be in a situation where they've got to make the commitment before they've experienced it. But as much flexibility as you can there, understanding that you have to have a decision for planning by a certain date. I understand. I just want to make that point. Last questions. One thing that Superintendent Moore, we had talked about individually was the idea of a dashboard. And I know that putting together something like that right now would delay the work we're doing on reopening. And so I definitely don't want to ask that. But as we move forward, as we look at community health, as we monitor the safety of our schools, is that something that you think we might be able to put together to help families and staff and everyone have more confidence in how things are progressing as we go into the second semester?
I do think, and thank you for bringing that up. I do think that there is a really good opportunity before us as we look at the features of what reopening looks like, and we're setting some goals for what we expect to track those things so that we can, our community can know how we're doing with the reopening, and it can drive potential decisions or discussions about other changes that might need to be made. So yes, I do think that there is space for that, and we will work on what that might look like and bring it forward.
Fantastic. And then just my last question, Superintendent Moore, I've heard you speak about this before, and it's come up before, but just for, how do I phrase this? We've reemphasized the importance of the plan in terms of the 3 W's and the protocols in place. And Dr. Benjamin has talked to us about where schools, districts have had successes and where they've had failures. And I know you've made it a priority, and you've talked about how seriously we have to take this. And just, an organization as large as Wake County Public School Systems, you have many different administrators, many different schools, many different environments. Could you just set out what your expectation is for compliance with these safety protocols? Ms. Scott had asked about, ways that people can report things. I've heard suggestions. I know you have COVID, like a coordinator on some campuses, but just what is the expectation, and how closely will you and the leadership be monitoring that? And that's my last question. Thank you.
So as you've mentioned, it is critically important that we follow this guidance. And I have framed it, my inclination is to frame it from the lens of how we take care of each other and ensure that our return to in-person instruction is successful. I think that is something that clearly adults, I've been known to say that there's no such thing as unsafe schools, but there may be unsafe practices of the adults, and maybe children as well, in schools. And so how we set the framework for that culture of understanding what's important and accountability around doing that is really important. For me, that has started specifically with the messages that I send to my leadership team, a message that I have sent to our principals. And I think that for our principals, because we have obviously lots of different grade levels, lots of different personalities and leadership positions. And, some people might frame following these directives as being some sort of a policing state or something along those lines. I reject that characterization of doing this work because I do not think it is productive in getting us to our goals of safely reopening schools and making sure that our staff and our families and our students have confidence about being in our school buildings. I do think that there is accountability with the leadership of the school in ensuring that their staffs understand what is expected, that they model it for their staff, that they hold their staff accountable for when it doesn't happen. And it doesn't have to be, banging people over the head. until it's time to bang people over the head. But it is something where it's almost like tough love to begin with, and it gets tougher based on what is or isn't happening. I do think we have to have an understanding of why noncompliance doesn't happen. This is similar to any disciplinary action that we may take, even with a child. Understanding why it's happening is as important as how we choose how to correct or build capacity to ensure the behaviors that we need to see to safely reopen schools. So for me, it is very serious. And when I get reports, and we get anonymous reports through our Let's Talk app quite frequently, actually, about a number of things. And so how we build that capacity and that accountability is going to be really important. And whether it's a separate app or the existing Let's Talk platform that we have, or how we message to our leadership in schools or those who are listening today, this is something that can't be an issue. There are just not good reasons. A mask is not an intrusive and incredibly effective way to ensure that we are opening our schools safely. And that's something that we just cannot compromise on. I lead it from how I act and what I expect of others, and how I communicate clearly what those expectations are, and that principals know that they are accountable and have a leadership role in their district to model, hold folks accountable, to inspect what you expect, and to create that culture in the building to do so. And that we provide venues and opportunities for when it's not happening, whether it's anonymous or not, to follow through and course correct as needed.
Thank you, Mr. Sutton. Those are all my questions.
Thank you, sir. Ms. Johnson-Hosler.
Thank you very much, and glad to go after that very well-stated and passionate response, Ms. Moore, responding, which leads right to my first question, which is really around, to your point, inspecting what you expect. I have no idea when this could happen. I've looked at the calendar, but one of the things that still that we've talked about and you all have answered, but that really is, have we considered, could we figure it out even if it's short video? I know our WCPSS comms team does a great job of really walking people through the protocols and practices in their buildings when they return. I know that our educators and our administrators did a good job of creating kind of a virtual introduction to their students and their families. But again, the best laid plan without really helping people know how to execute it, I think sets us up for the inability to change the culture around wearing masks, waiting the 6 feet, washing your hands, and really institutionalizing those is really to let people see how it's going to work. If we have buildings where they're only going to use hallways going one direction to minimize contact, I feel like some of those things, and again, this is work for somebody, I acknowledge that, but I am most worried about people responding without having an understanding of, right now we're talking and saying we're going to do this, but they haven't been in those buildings with our students yet. And so just something for the comms team to think about is how we could actually build out a short video to walk people through what does this implementation look like all day. And also I think it would ease some of the stress and anxiety of people who absolutely may be ready to come back, but again, the way trauma works, because we've all experienced trauma from March to now, not being in the building in our regular way with students and educators, is really preparing people for that moment of shifting. So that's my thought for communications folks to consider, since we don't have time to actually gradually allow people to come in and practice those protocols, which a couple of board members have mentioned that as an option. So I'm throwing video option as a way to distinguish those protocols and policies that will certainly look different in the building. The other part of that for me, as I talk about, triggers and trauma of entering a building that you haven't been in, that certainly you still are going to have some social anxieties around the fear of contraction, is, have we thought about what social and emotional support looks like when we're back in that building? Again, teachers generally get to be in community with each other, just like students do, but they won't be able to be in community. And one of the, I think, protective factors that teachers have been able to build in is the relationships with the folks in their building, and they won't be able to congregate in the same way. So I'm wondering if we've thought about ways to provide some social and emotional support for the change of having students in those buildings, and for educators who haven't been in the building but will have to return. So as we lay the plan, I'd like for us to think about ways to address the social and emotional well-being of those adults in the building. And of course, I think it goes without saying, but I will say, and I certainly hope that we will do as the model schools in Fuquay, my district, have been doing around ensuring that social and emotional is a part of their school week, even whether we're in the building or virtually, that both sets of students are getting some social and emotional support. And I'm not sure if Mr. Coe and his team, Dr. Coe and his team have thought about that, or anybody have any feedback that no, that just won't work. But I'm certainly hoping we can figure out how to do social and emotional for both students and educators when we return.
I think Tim Simmons had a couple things he wanted to share, and then maybe Dr. Coe.
Okay.
Yeah, Ms. Johnson-House, I was just going to share, we've had that very discussion, in fact, this week on videos. I think more than likely, it's probably a series of small videos. This is what the lines look like. This is what the directional signage looks like. This is, what various protocols look like, as opposed to, as Lisa Luton and I were talking about this, as opposed to one long video, then some DHHS changes the guidance in one part and all of a sudden your 2-minute video is, out the window. But yeah, that's what's coming. Now that this is becoming more real, so to speak. I mean, as of now, there was not a great need to create a bunch of videos about what school would look like while you were in remote. But as we get closer and closer to in-person, what we're probably looking at is a series of small videos around each of the types of things that you just described.
Perfect. I trusted the comms team would have been thinking about that. And I certainly appreciate, I was trying to figure out how to squeeze it all into video, but I do like your idea of doing each as small videos, because not only is the science evolving and we're learning more as the weeks go on, but so are the guidelines, to your point. So thank you and your team very much for already considering that. I also would say, before Dr. Coe, if he wants to add anything, is I also think those video vignettes can be helpful for reducing anxiety of giving people something to look at. And it's also a little reminder, Superintendent Moore talked about, we need to ask the why if our students aren't following the rules and wearing their mask or forgetting their mask, because the why is going to be important to that. But I also think that those videos can also, because of course, as I said earlier, I want us to hold people accountable, but I don't think accountability certainly means suspension, which is just simply meaning returning students to virtual academy or creating a virtual, alternative learning center. Like, how does that really work? And really trying to think of ways that we can use tools like video vignettes as reminders and ways to educate people. And it also is a reminder for the adults. As we've heard, people have been reporting folks at their school who haven't been wearing their mask, that these are just like, here's your reminder that this is our expectation of what things should look like in our building, which I certainly know would alleviate some stressors going in, knowing that we have some ways to remind people and be considerate of the anxiety that is going to clearly be in play. So thank you, Mr. Simmons.
Paul. Okay.
Yeah, and thanks for your comment, Ms. Johnson-Hostler. So in regards to the social emotional learning, it's housed under our behavioral health steering committee that's connected to the core team. And we know that we've known for a while that opening and remote learning is one format in which students and staff have reconnected to school. But we know that the return to in-person is going to be another pivot that all of us are going to be going through together. So we've been thinking about that as a team already, and I think we're not trying to start things from scratch, but we've already provided some core resources. And we know that because principals and teachers, I think they've all worked really hard and done an excellent job in doing what they can and making sure that the last 5 weeks have been successful. But we know that in the pivot to in-person, there's going to be some additional ways where we help support schools and their teams to be as successful for the return. So we're trying to figure out what are the things that we've done well, what things are we still questioning from the resources we've given, what things should we stop, and then what are the places in which principals and school teams will learn best, whether that's in principal like PL sessions or it's through office/support hours that we could bring folks in voluntarily to kind of problem solve and think through what the in-person return will be. So we're thinking through all those steps, and we're in the process of this pivot, just like, you know, our district is. So we're working on that, but I just know that that is on our radar for sure.
Perfect, thank you. And which you can probably keep your camera on, because I think you may have, this question might be put to you too, Dr. Coe. So I've talked to a couple of friends and colleagues who are educators in other districts who have started to go back before us. And one of the things that I personally hadn't thought of, which is surprising because I all know I spend my time thinking about the psychological and emotional impact of everything we do, which was for some students experiencing, if they have a kindergarten sibling that's able to go to school and they're in the 5th grade and they're not going, that is certainly also going to be something we have to help be proactive on, and helping parents think through that for those who are coming in the building, that your older sibling may not be going, but your younger sibling may be, and the ways in which that certainly is a dynamic that we would be creating for families. That's not a common dynamic, and I haven't really heard anybody, I certainly haven't, discuss what ways or what things can we do to start being proactive to share that with families and educators who may now experience their students shifting in their virtual learning because they are still virtual and their sibling isn't. So I certainly hadn't considered what that disconnect might be for young kids.
Yeah, I think that's a great point, and it's something that I think we should explore on how do we help families talk about those situations. And I think I'll also see if anyone from the academic side, whether it's Drew or someone else, has any thoughts on like scheduling. But I know it's something we have thought about, but right now I think we have to dig more to have an answer.
Thank you. Thank you. I certainly hadn't thought about it, so I didn't expect you to have one, but maybe. But it is something I think we should consider, especially when we're talking siblings, and specifically if they are all in the same K-5 school, but everyone doesn't go back. Because I stress the sentiments my colleagues have already stressed about larger class sizes without knowing the exact number for our older grades, 3, 4, and 5, but specifically 4 and 5 especially. So something to consider for those families that may have that unique situation. And I certainly believe there'll be several of our families that may have that as well. I think all of my other issues have been addressed, with the exception of, I don't know that I heard anyone address not just mask, but also hand sanitizer. Again, when we're thinking about the anxiety that people are going to return back in the buildings, generally hand sanitizer is one of the things that's on the list for parents to purchase for their schools. But no longer are we going to be able to send in, this big container when we have littles who will be using the pump with the hand that hasn't been cleaned or sanitized. So I know that PPE has been difficult, but I certainly do want to put out the thought that we start considering, because hand sanitizer is still difficult to get. I just ordered hand sanitizer for all 100 counties in my centers, and it is, like the school district, it's been a struggle to get everything we need. But I want us to add hand sanitizer as an issue that we're considering, in addition to mask, and what that looks like and feels like actually implementing that in school, which will be different than most of us, or at least me as a parent. I always bought the very extra large, big bulk store brand to bring into school so that multiple users could have access to it. And especially for somebody like me, who it's peak allergy season, flu season is on its way. So just things to consider in terms of what we may have prepared, but not really thought about single use for students and educators once they're back in the building. The last thing is device replacement. So again, we've done a great job. Many of us have had the great opportunity to volunteer and provide some support all summer of getting those devices. So I'm curious, are all of our schools devices that they may have given in the count when we were distributing, especially in March before we made a bulk order, are all of our schools replenished, or at least our K-5 schools, our elementary schools, replenished with their devices at this point?
I am so glad you asked that question. At this point, no. If you'll recall, we placed an order that you all approved last month for 85,000 additional devices. Those will begin shipping to us, actually to the supplier here in Durham, in December. So we will not be able to start distributing those out to our schools for one-to-one until beginning in January. And it will probably last through May, June, because they'll come in quantities of around 17,000 each time they come in. And so we'll be developing that plan and working with a collaborative team to figure out how to best figure that out. And that'll include principals and teachers on that team when we do.
Perfect. That's good. Because again, I kept thinking about devices of, okay, are we going to expect, since we've distributed so many devices, for our young people to remember to bring them back in that building with them? And the answer is we probably will have that expectation. But again, I'm going to keep saying that we have people who have currently experiencing stressors and anxiety. It's going to heighten if and when they're back in those buildings. And so just thinking through all the things that a student may not remember to bring a device. And so working ahead to help our principals and teachers think through, how are we going to deal with that when of course, Ms. Nelson-Hassler saying it probably shouldn't be punitive, but recognizing that our schools aren't replenished yet. And so what is that going to look like with devices if our students also don't remember them, if they need to have them back in the building? So thank you for answering that. I figured it was just like hand sanitizer and PPE. We're still waiting for these bulk orders, but certainly thank you for responding. And I will put a plug in to you since I can still see you, Ms. Gaddis, is, we've talked a lot about pre-K, which stays on the list for me of bringing them back. And then, thank you for several board members who brought it up, is tough books. Those would be great options for our littles because you can drop them. They're really hard. Law enforcement usually uses them because they ride around with them in the car. So I really am clearly a proponent of having some. Ms. Hamilton, I don't think we should be teaching full-time pre-K online because it's hard enough for, our high schoolers, not alone 4 or 5-year-olds. But I do hope that we think of some ways, again, back to these video vignettes and I think Ms. Cash also talked about this, of how do we help provide some information and structure that we would generally be teaching pre-K for those young kids and families who aren't going to be able to come back into the building at any point. So it's both a plug for a different type of device, maybe for our littles, but also considering what ways we can provide some resource to those families for our younger pre-Ks who can't return back because of their families. So I certainly want to put a plug in for something I hadn't asked for before, but I saw a little kid with it last week while I was volunteering, and I thought it was a great concept for little kids. So thanks for letting me ask about that and put a little thought for you, Ms. Gaddis, on that.
Absolutely.
Thank you. I think all of my other questions have been asked and answered. And again, thank you very much for all of the work that you all are doing, and our principals and educators who are trying to determine how we're going to begin to actualize this. And the last thing I'll say is, and I have said before, the commitment to creating a safe pathway forward is a priority, remains a priority. And it's, for me, it's also holding multiple truths that we've been talking about a plan and we're not still finalized on a plan. And that plan will simply be paper until we can actually figure out, again, back to this, some of our concerns about not being able to phase in, that it's much harder to implement something this difficult with new school, online school still happening while we're back in the building. So just a reminder to people that safety is a priority, and realizing that implementation of a plan is going to be more difficult than any of us can express. And so the ways in which we can provide social and emotional support, I strongly encourage and would appreciate. And thank you all for all of the diligent hard work and answering our tough questions, even when they may feel circular. We're just trying to make sure all the pieces are on the table that we're thinking through. And again, thank you so much, Superintendent Moore, for your leadership. I cannot imagine sitting in that seat while we're doing something nobody else has done. There's no roadmap. So thank you for your leadership.
Thank you, Ms. Johnson-Hassler. Mr. Fletcher. Mr. Fletcher.
Thank you, Mr. Chair. It's obvious that the graph in the presentation on page 16 that shows us the reentry of cohorts 1, 2, and 3 into elementary school is based on the traditional calendar. And when will we make known to parents who have students in other calendars what this schedule looks like for them? I understand year round comes back into school before the 26th. There's a tracks back in. The early college programs have a different exam schedule. So when will we be able to communicate to parents how our reentry plan affects those students in those calendars?
Mr. Fletcher, I believe that the calendar we're proposing contemplates, I can confirm, I think it contemplates that. So year-round comes back for 1 week after their track out prior to October 26th, if I recall the calendar correctly. So they would remain in remote for that 1 week and then begin the 3-week rotation the week of the 26th. So they would all be year-round, and traditional would all be starting at the same time, and modified as well, because they're only a couple of days different. I think we do need to take a look, as Mr. Cook said earlier, what's happening with our early colleges that are aligned to the community college calendar. But all of that will be part of what we bring to the board for a decision if there's anything different in it.
Okay, thank you very much. We had expectations of bringing our regional special ed programs in September, and that was not done. Can you speak to the opportunity and challenges or opportunities that are related to bringing our pre-K to 12 regional programs in full time starting on October 26th, as opposed to being on rotation? That small group of students be in the building full time as opposed to rotating in and out.
Which group are you
talking about? Our special ed regional program students in particular.
Okay. Karen, do you want to start that?
Sure, I do. So, Mr. Fletcher, I think when we initially proposed bringing those programs in earlier in September, we had dependencies that we couldn't meet. Right now, I think we're in a space of when you know better, you do better. And from the collaboration with the ABC scientific folks, I think that the most important thing that's resonating with me right now is the plan. And not only having a plan on paper, but one that we can walk through with our families, one that we can walk through with our teachers. I think that your question is worth consideration. I don't think that I don't think I'm in the space to propose that today, but I do think it is certainly open for further exploration on how we can establish that and how well we can get it implemented and practiced. I think an important thing with the rotation when we think about our pre-K and our elementary teachers is the opportunity that Dr. Benjamin was talking about to have the plan, utilize the plan, practice on smaller groups of students. So I don't think I'm answering your question with a date. I think I'm answering your question with we are open for consideration.
Okay, all right, thank you very much. I know consistency is important for some of those students, well, many of those students in those programs, a daily routine that they follow, and rotating in and out would seem to be a challenge for those students who have that particular need. I understand where there are compromises that we're having to make in a lot of cases.
I understand your concern, and I think that we hear from our families daily that that is a concern for them as well.
Okay, thank you. We have, as I understand it, there are about 4,500 children in the FAST program. 2,500 of those are receiving childcare. Those receiving childcare are children of our staff members. I don't know how many of those teaching spaces are actually in our buildings, but when elementary kids come back into our buildings, what does that do to the space available to provide childcare for teachers whose students are in rotation and not able to be in the building with their parents, or their parent may be in an upper grade and doing remote from some other location? So how does, from a space standpoint and a resource standpoint, how does our plan affect the students of staff that are in the FAST program?
So I'll start this. I don't know if Mr. Simmons, who's been working with our partners, we've had some discussion, we'll have something to add, but we've had some discussions about clearly once we return to in-person instruction of any type, we need to consider how the FAST program looks for the children of families, but also the support that we've been providing the children of our staff. And there are a couple of options, whether it continues to be a program that's available in that school, or if there are other options for how to address it. But we know that the need to try to work with our teachers who will now be teaching students in rotations in the classroom, and their own children might be in a rotation until they get into in-person instruction, that at least for that period that we're in rotations, we need to determine what our options are and how we can provide support. So that is being discussed. We don't have a decision. Okay, all right. There's so many aspects to this that the general public would not even know that that staff is working on. I appreciate all of that. We had a couple of my fellow colleagues mention the need for additional resources to deal with oversized elementary classes. I will remind them and our community that we have been begging for the resources of school counselors, nurses, social workers to support classroom teachers for the last 3 years at least, and have made a small dent in the need that is there with prior budgets. This year we were not able to advance that effort, but there's a significant need for additional resources in our schools. And as COVID has revealed gaps in service levels to many members of our community, it is really emphasizing the gap that we have in terms of these particular professionals to support teachers and to help students deal with the trauma and the anxiety that they have experienced at home and as they return to school, and the whole disruption of whatever their common lifestyle was before March 13th. So we have significant needs beyond the available staff, and that's a long-term goal that our community hopefully will help us be able to address. And I also want to applaud staff. It was clear in this presentation, Ms. Superintendent, that the emphasis of the planning has been on the health and safety of our students and staff. That's paramount. If we can't accomplish that, then students aren't coming back in the building. It's also important that as I laid out my expectations early on when I really was able to get my head around this whole issue, is that we wanted to keep our teachers and staff employed. We've been able to do that. And as we move forward, we're going to be able to continue to do that. We wanted to keep our students enrolled. And as of today, I believe we have somewhere close to right at 160,000 students. There are less than 2,000 that we're not really sure where they are. And I think that's remarkable, the commitment from the community to their public schools. And the next issue is to continue and improve upon the teaching and learning that's been happening since we opened up with everybody in a virtual environment. Our teachers have, as our principal of the year last year shared, all 191 principals in Wake County are first-year principals, because none of them have ever opened school with what we're dealing with. And the same can be said for our classroom teachers. I don't know that any had ever dealt with being in a complete virtual environment and having to engage and I mean engage students for extended periods of time when they are in 20 different locations than where she or he may be. So I applaud our teachers. I applaud the support staff, our bus drivers who've become child care workers, our child nutrition people who continue to prepare meals, and they're being delivered to families who are food insecure.
Thank you for what you're doing. There are a lot of compromises that we're having to consider in this plan. I look forward to seeing the answers to the questions my colleagues have asked between now and next week. Let me share a couple of things that I learned today because I'm preparing for a presentation to a civic organization tomorrow. And we have 10,000 battery operated hand sanitizer dispensers installed in our schools. To support them, there's an initial supply of 10,000 gallons of hand sanitizer to fill those dispensers with. In addition, there are 10,000 pump dispensers in spread across our classrooms. There are 900,000 reusable cloth masks available for students and another 100,000 reusable cloth masks available for teachers. And the support goes on and on and on. Cleaning protocols in the building, cleaning protocols for our buses and our special transport vans. These things are in place, and we should applaud our staff and particularly our procurement people for being able to get these resources and to have them available and to have stockpiles waiting to replenish what's in the schools already. So thank you, Madam Superintendent and your staff. And I look forward to the updated presentation next week. Thank you.
Thank you, Mr. Fletcher. Mrs. Happy, did you have another question?
Yes, Chair Sutton, I had one more, and I thank you, Mr. Fletcher, for raising the question on our regional special ed programs. I know many of our families are anticipating the answers to that question. Superintendent Moore, in looking at the calendar on our return, our year-round students track back in on the 19th of October, but that's going to be a remote learning before in the plan that you've laid out. Is there a possibility that we can use that week for some orientation days to get students familiar with protocol? We have kindergartners that are new to school. We have sixth graders that are in a new environment, freshmen, where their orientation was just a trip through the carpool lane. Is there an ability to give students a way to look into the building before they come back, either on a rotation or daily? Thank you.
Thank you for that question. I think that's definitely something that we can take a look at and have an answer for you next week. If you're talking about the week of the 19th, I guess in particular, really, it could be for all grade levels, but specifically for pre-K-5 and prior to starting the 3-week rotations, to have an opportunity to be in the school. I know that a lot of schools do try to do some type of meet the teacher opportunity, and this year it may have been through a drive-through protocol, as you said, as opposed to in the building. So we'll take a look at that, ask some of our staff to look at it and communicate with principals and have a decision for you or a recommendation on that by next week.
Thank you. And again, thank you to you, your staff, all of our teachers, principals, and parents who have been a part of this process this week or two. And Chair Sutton, those are my questions. Thank you.
Thank you, Ms. Mahaffey. Mrs. Cash.
Yeah, I'm sorry to ask one more. My question was, we've had some surveys, and I know the Division of Principals has some recommendations. We have a survey that came in from teachers. We're waiting on one from the parents. So it feels like we haven't talked about any of that. When will we, it feels like we should be talking about that. Like the Division of Principals, like I know there was something that they did.
Right. So yeah. So let me just start with all of those individually. I gave a little bit of the highlights today from the teacher survey responses. Mm-hmm. We should have that ready by about tomorrow, ready to go. The parent survey was taking a little bit longer because of the translation, because we offered the service in Spanish as well, but that should be ready in the next couple of days also. And then the questions that the Division of Principals asked, principals, administrators, like Division of Principals and assistant principals, their board represents a cross-section of administrators from all grade levels, APs, and principals. And they had some questions and did sort of an informal survey of their own folks that were part of the leadership, not the whole division, around some questions and needs and perspectives and concerns about reopening. So we knew that they were doing this and asked them to let me know what those concerns were so that I could share them with the core team. A lot of those concerns are about implementation, about having time for different things, clarity around some other things. And so the core team is working on that. I think it is an example where we want to hear from folks in different parts of the organization that have questions or concerns so that we can actually address them and provide responses. I don't think, our principals are not any different from our teachers, as I spoke earlier. The small sample that was surveyed as a part of this feedback is very uncomfortable and not sure if we're ready for a return prior to the end of October. And so the questions they are asking really are also, the answers will also serve to build that confidence and understanding there as well. It has to happen at all levels of the organization.
Well, so I'm just going to just ask one more thing. So I thought a while back, we talked about how principals were feeling that grade levels coming in one at a time, especially on the elementary level, was easier to do than 3-week rotations. Can they actually implement 3-week rotations in the elementary school?
I'm not sure what you mean by one grade level at a time.
Like kindergarten,
You mean the
full
whole,
time,
you're talking the whole grade level?
Yeah, that's what we talked
all
about
at
one
once?
time.
Yeah, I think if we hadn't been in remote for the period of time that we have, our purpose in looking at a rotational block prior to going back fully in person is to provide time with teachers in small groups of students to practice protocols, to get used to what it means to being in the building, to set norms for what it's going to look like for when they do return fully in person versus going from fully remote to fully in person. We do feel like the step in between is important. And I think in listening to Dr. Benjamin, part of what he said was that with the districts that have already had some experience with Plan B, that they have seen success with ensuring that the students are split into a hybrid model where they're not all attending at the same time, at least to begin with. We don't have the data yet on what a Plan A looks like.
So I'm not actually at this point talking about the safety, I don't think at this point. I think I'm just talking about implementation of the grade levels and how they're going to do their teaching allocations and all that. I just want to be sure the principals can do that.
Yeah, so I'll repeat something I've said a couple of times, right? There's no good Plan B. This is not easy. It is asking a lot of our principals, our teachers. It is the right path from remote to full in person to break it up prior to going to full in person. And the feedback we're getting as we reach out to folks is, yes, we can do this. This isn't going to be easy. I haven't had anyone tell me they can't do it. I don't know if maybe somebody else needs to ask them, but that is our work, and that is what our plan is and what we're proposing.
Okay, thank you.
Thank you, Mrs. Cash. Ms. Johnson-Hosler.
Sorry, I do have one other question, which is very on the heels of Ms. Cash. Are we going to talk about before we wrap up what and how we should anticipate our next week's board meeting for voting? So I guess I'm asking, are we going to Ms. Cash's point, are we going to just vote on, yes, we're going to do Plan A with our hybrid rotation? Are we going to vote for all grade levels, a return date? Do we have a sense of kind of what our process will be next week? And of course, I'm recommending that it's not the drafting, but I'm recommending that we break those up. So elementary school, the middle school, then high school, or are we just going to do one fell swoop and say these are the dates?
I think that's really at the pleasure of the board. You know, we've got a proposal for each part, but if the discussion and the decision points have some nuances by grade levels, which quite frankly makes sense based on the fact that the governor himself has put out options out there that are distinguished by grade levels. Certainly, if the board desires that we split those up, and therefore you can ask questions or make changes or decisions based on what we're proposing by grade level, I think that's certainly possible.
Yeah,
we'll have feedback from other board members on that.
Thank you.
Yeah, I can work with staff and we can try to structure the agenda so that it's broken up, if that makes it easy. Mrs. Kushner, did you have a question? Ms. Johnson-Hanson, did I answer your question? Were you done?
Yes, you did. Thank you. And thank you also, Superintendent Moore.
Mrs. Kushner.
Thank you, Chair. So just a quick additional comment. I wanted to underscore something I heard Dr. McFarland say earlier, and that was that there is so much anxiety amongst our educators, our principals, our teachers. If we can lessen that anxiety by more community work, collaborative work, there are principals who may be really have figured out their buildings and have some great ideas. If we can share those across the district, that should be the power of having such a large district, 191 schools, that we are leveraging that knowledge that we have throughout the district to lessen the anxiety and to lessen the risk that we have in our community to protect our educators and have them, as you've said, feel more confident in returning to school. Thank you.
Thank you, Ms. Kushner. So Superintendent Moore, that does it for our questions. I guess it would be appropriate at this time, maybe we'll take a minute to sort of summarize where we are. I did not hear in the questions. I didn't hear what it sounded like any disagreement with the recommendation. I did hear two questions around, could we get pre-K or a pre-K to second grade to come back earlier? Ms. Cash raised that question. And then I heard Ms. Mahaffey ask about an orientation. So those were the only substantive changes that I've heard to what was presented today. If I'm missing something, board members, please speak up. But that was all that I heard in terms of what was presented. So could you just kind of summarize where we are at this point and what we should expect to be voting on this week?
So if there is a desire, and this would be the will of the board, so you guys should have this discussion right now, to accelerate pre-K2 any sooner, with the questions that staff would have are, how much sooner? And is it about starting the rotations sooner? Or is it about starting at the same time, but all in person, which, I think there's sort of variations on a theme with what could happen there. So I would need the board to provide us direction on which of those you want us to either tell you we can do or can't do, or have ready for next week. And we're open to that. And then I did I think I said to Ms. Mahaffey that we will have a response fairly quickly that we can provide the board about the week of October 19th being an opportunity for some or all of the kids to get some opportunity to get into the building.
Okay. So what I have heard, again, is the presentation of a 3-week rotation, and in the conversation that the 2-week rotation was explored, but is not feasible at this time. So can I assume then that there is a consensus around the 3-week rotation?
Yes.
Yes.
Anyone somewhat opposed, have any heartburn with the 3-week rotation?
Well, I mean, I had my hand up there. I agree that the 2-week rotation is not possible. I don't disagree that the 3-week rotation is, is potentially a reasonable step for getting things back. My heartburn is two things as I've indicated, and so they weren't in your summary of what needs to be done. Is I believe, as Dr. Benjamin indicated, compliance is the critical thing, and so I personally need to see more progress toward whatever our accountability structure is going to be. I don't think we can just say we're going to have one. I think it's pretty critical that that be more fleshed out. The second issue that I have is not unlike Ms. Cash's last question, which are also the questions that came in the division of principals statements. Is the practicality? How do we make it happen? And specifically, I'm concerned that this plan is potentially authorizing us to go to a situation where we will have congregate gatherings of more than 25 people at a time inside one classroom. That is still a statewide guideline. And so I'm actually—
Doesn't affect the schools.
It does not directly apply to schools. That is correct. I had a 40-student class in a 125-student lecture hall where we cannot put 40 students in the standard classroom in Wake County Public Schools. So I understand the guidance is an exception to schools. At the same time, from a safety perspective, I'm also very concerned about creating scenarios where we have more than 25 people in a common room. We're talking for 6 to 8 hours at a time. So those, are still major issues to me. I don't have magical solutions, but that is what gives me heartburn.
Dr. Martin, I think your concerns were noted, and staff is working on those, but those weren't decision points of the board. So I was trying to summarize where we were with regard to specific decision points for Tuesday's meeting so that the board and the public was clear on where we are.
I hear you. I personally believe the accountability structure is a decision point.
Okay. I think staff responded both from an HR standpoint and student services standpoint with regard to what consequences would be that they would come back to us on that. I'm fairly certain I heard that.
Oh, I hear you. I'm just saying that before I vote on a plan, I feel like I need to see at least a substantive draft of what we're talking about. So I agree that staff responded that we're working on it, but we're talking about voting on a plan, and our job is a fiduciary governing responsibility, and I find that to be a component of a decision that we really need to be thinking about very carefully.
Okay. So again, I'm asking about the three-week rotation, and I think I heard consensus there on the 3-week. So I'm thinking about the grade level configurations. Mrs. Cash has asked the pre-K to 2, and then we have what is recommended by staff with the pre-K to 5. Any changes?
Well, I just wondered, I'm just thinking out loud, and I don't want to take up a lot of time, but I think this was asked to me. The K2 had a couple of options. It was either coming in on a rotation, but that would have to begin October 5th, from what I understood, if we actually did a rotation early for K2 first and then fall in. Or K2 coming in on the 26th full time with the other 3 grades going as a rotation. And then I also spoke a little bit, and I need information about this because this is a big factor in some decision making, is can we compact that K1-2 schedule so kids at K1-2 are not sitting in front of a computer? Because that's my biggest concern.
And I would just to add to Ms. Cash's points, staff would not recommend bringing any grade levels in without doing a rotation first, without phasing them in cohorts first. Staff won't recommend that. Which is to Ms. Cash's point, in order to bring K2 in any sooner, if you were going to bring them in one full 3-week rotation sooner, that is October 5th. And that, I just feel like that's a stretch. So that's not a staff recommendation either, but I want the board should discuss and see where there is appetite for decision making around any changes.
Okay, well, that's coming from me as one board member. That's what I would like to see so the K2 can get in sooner, because I'm not hearing a lot about compacting their schedule. And so to leave with me not saying that that's a huge problem would mean that I would have to go to an October 5th start rotation or an October 26th all in, or somehow compacted schedule for those kids since they're going to be out till the 26th.
Okay.
Or actually till November, because half will be at home or in daycare the other 2 weeks. They can't, I don't think they can go till November 16th in the situation they are in our daycare centers, where they're sitting in front of a computer, K1-2, all day. And we can't fix that in any of our centers, especially in the Y-FAST program, unless we get them into a compact schedule.
Right, right. That is your sort of other side of the coin for the concern, yeah.
Yes, ma'am.
All right. So you've heard Mrs. Cash's request or concern, and thinking about bringing in K2 earlier, option being an October 5th start, would be what staff would be recommending if we did that, given the need.
I don't think
rotations. It's not.
There's no staff recommendation in that.
But if we were to accommodate that, we would at least need 3 weeks, is what I'm hearing, which would again.
There's some operational efficiencies if you don't do that, inefficiencies. So that's why our recommendation is what it is. Yeah.
I do hear her concerns about the amount of screen time for the younger one. So can we explore?
And I do think we need to deal with
the compressed schedule that she's talking about, or the change up in schedules?
I do think that Drew Cook is working on trying to see if we can't, especially because of the timeline we're talking about, the more quickly we can implement some sort of a decision around that in terms of how we approach the day on a more standard basis, in particular for K2. That would help alleviate with what the other side of the concern in terms of why we would need to bring them in sooner.
Because while we're hearing, the concerns about our teachers and re-entering the building sooner, we're also hearing so much from parents of younger K2 students that are quite anxious about the increased screen time and the technological remote learning. So thank you, Ms. Cash, for that.
Thank you, Ms. Kushner.
Well, and I'd like to also support. I mean, I agree with Ms. Cash that K2 is. I mean, virtual instruction does not work well for much of anybody from a great educational standpoint, but it really doesn't work well for our youngest children. Too much screen time is absolutely a legitimate concern. And this is where I just want to be very clear. I think some people try to communicate that I am not for opening schools. Nothing could be further from the truth. The reason I am so strong about we've got to have good accountability measures is I believe that if we had strong accountability and a strong plan, we could be fully open today. If we addressed the staffing issues that I have been calling for early on, and I know that there are limits of what we can do, but we've got to be serious about that. I believe if we actually took some of this harder action, we could open more and faster, as opposed to where I'm concerned we are now, because I really am concerned that where we're going is going to make it more difficult. People need to recognize that if you're in cohort 3, you're in the 3rd week before you get to come back in person. You've got 1 week out of 3 that's in person. That means for the entire semester, I think you only get like 2 or 3 weeks in person, right? That is not in-person opening. So I just want to reinforce that I want to see us open, but I want us to see us open safely. I want to see us open in an achievable fashion. I want to see us do it effectively where we don't actually burn out all of our people. And that is why I am so strong on this accountability guideline, because as Dr. Benjamin has said, and as all evidence shows, if we had strong accountability, we could be open today. As a community, we have not yet decided that we're going to be accountable to each other and get this infection rate down. If we did that, we would be open today. I want to get us open, and that's going to require strong and careful accountability plans.
Mr. Hagerty.
All right, so Dr. Martin, it's clear you feel very strongly about this. You've raised this issue several times. You keep using this phrase, accountability, accountability, and accountability. We've talked about things that I think reflect accountability. The superintendent has talked about her vision of accountability. We've asked questions of staff. They've given us answers about protections to help guarantee accountability. Clearly, there's something that you were thinking, that you were looking for, that has not been addressed. But with all due respect, I don't know if myself or other board members, we don't know what it is that you're conceiving that you want to see addressed that's not being addressed. And we know this is an important issue. Our entire community is watching what we're doing. You have valid concerns. I know you're a dedicated educator, but could you please tell us in plainer English what it is that you expect to see that you have not seen? Because I want to listen and give due consideration to your position, but I'm afraid after all of this time, I still don't know what it is that you want.
I'll make it as clear as I possibly can. Back when we first started dealing with this, I asked for us to look at our student code of conduct and other codes of conduct to understand how we're going to implement into policy our expectations. For the first time today, and I very much appreciate what we heard from Dr. Matillo and Dr. Coe, we heard that we are talking about what this will look like. What I'm asking for is seeing what this will look like. I very much appreciate that for the first time, we actually heard acknowledgement that we're trying to formulate that into some kind of a policy. That needs to be in a policy, that needs to be communicated so that our staff understands it and our community understands it. As I mentioned in my early comments, whatever this plan is, needs to be careful that it does not become yet another way to create equity gaps. We need to create a plan that if you're struggling and there's reason for it, we're going to work with you to help meet those guidelines. But if you choose to violate those guidelines, then there has to be additional consequences. No one has the right to infringe on other people's health and safety. That is the crux of what this accountability plan needs to be. I am pleased that tonight I heard the first steps toward actually formalizing that. I have looked throughout all of our Wake Connect websites, and there is guidance, there is recommendation, there is statements of requirements and expectation, but at the end of the day, I don't know what's happening. For example, at NC State, I was told that if a student comes into my classroom and refuses to wear a mask, the first thing I am to do is to offer the mask. That's why they supplied these masks. We provide them anybody who needs them. That is the first thing to do. If that is problematic, I was told as an educator that I need to go to the Office of Student Conduct. I don't have to deal with it, but the Office of Student Conduct will deal with it. We need a similar kind of structure in the Wake County Public School System so that I, as an educator, don't have to solve the problem. I need to know if a child comes into my class and is not, I've tried to help and refuses, what do I do as an educator? That I think the same thing that people have talked about, whether it's an app or what, if colleagues are not being careful, what do we do?
Dr. Martin.
These are things that need to be specified.
Dr. Martin, I hear you, and I know we have a policy meeting coming up and possibly an additional one before the proposed timeline gets implemented. Perhaps Ms. Kushner, as chair of the policy committee, this is something that we can work on during one of those times?
Absolutely. I just gave you details because Mr. Haggerty asked, what are the details that I'm talking about? I'm trying to do as clear as I can.
But I hear you. I'm just saying right now, you know, we're finding a time to make sure that we can talk about that. And
Absolutely.
I believe a policy meeting, and I believe you would agree, would be the time to do that.
Yes.
Okay. I'm just letting you know we hear you.
I do want to just say then, if we're going to do a policy committee and this is a big subject, we need to allow enough time for us to deal with it, because otherwise we're not going to get anything done. I don't want a futility exercise.
We are meeting next week, and I will follow up with Dr. Garner on the agenda. Thank you.
Mr. Haggerty, did that answer your questions?
It did. Now, Dr. Martin, I've taken notes as best I can. I know that you have a busy schedule. You work full time as I do, out there in the community. If you have an opportunity, if you'd like to expand or write up anything that you can distribute before that policy committee, I would love to take a look at it. But if you can't, I'll go off the notes that I took in the recording of this meeting. Thank you.
Well, and I want to be clear that I'm not dictating what any of these things need to be. I'm suggesting that these are things that need to be addressed.
Mm-hmm. I appreciate that. Thank you. It's much more clear now. I appreciate that.
So back to the grade configuration, and I think Ms. Johnson-Hosser was touched on the issue of a separate vote. So I'm thinking about now the 6 to 12 configuration, and that returning then on November 9th, and that being on a three-week rotation. Any questions, concern, heartburn around the recommendation of a November 9th return for grades 6 through 12?
I mean, I do want us to be listen very carefully to the information from the Division of Principals, because I think they had a lot of issues. And I think Ms. Cash raised this as well. I mean, I think we have a responsibility to listen to and address their concerns, because I think the picture is distinct if you're in the buildings and on the ground as opposed to at a board table.
Mr. Sutton, that's certainly why I asked the question. Again, back to both Dr. Martin and Ms. Cash's point about hearing from our principals is high school especially has a lot of class rotation with teachers. And so for me, just basically looking at the calendar, and someone from academics can correct me. I mean, we would essentially only have our students in person with a teacher as they prepare for AP exams, final exams, no less than, I mean, it's not even, I don't think it's a full week on the 3-week rotation. So I'm expressing a very different concern because I do believe those are different circumstances. But again, I reserve the right to hear from academics, but that's me as a non-educator, not in a high school, that would be my concern about putting them back in the school, changing their routine just before exams. So I'm open to hearing from academics and the rest of the board, but that's why I propose that we consider separating it, because I do believe the circumstances and variables are different. And also the science is also different.
And are there solutions or changes that you have in mind or would like to see in terms of the return on the 9th or the 3-week rotation?
What? So no, I'm asking for a separate conversation because we actually haven't discussed the different variables for high school. And so, I mean, my thinking was when calling for a vote, I'd like them separated so that we can actually determine if indeed there are different variables that we want to consider for high school.
Okay.
And probably 6th through 8th as well. But in my head, of course, I'm a high school parent, so I'm certainly thinking about exams and AP exams. And we also have students graduating in December.
Okay. So we can do that. And so staff, Superintendent Moore, what I'm hearing is that we would split that vote and be prepared to have a conversational discussion around some of the variables impacting the 6 through 12 grades.
Right. I think that we can do that, but I would ask if board members have specific scenarios, questions, issues that they want to make sure staff is prepared to address. And I mean, we'll be there and we'll address it. But if you've got something specific that you really want to make sure we hit, please let us know what that is.
And I can still email you, but certainly mine is how much class time do they get in these cohorts as they prepare for year-end graduates and exams?
So just to clarify, we would vote on 6-8 separate from 9-12 as well.
No, pre-K 5 would be one vote, and then 6 to 12 would be a separate.
But the 6th to 8th graders aren't preparing. I mean, could we treat them separate or not? I guess we'll talk about when we do 6 to 12. I guess, okay.
Yeah, and I guess I should just validate. I don't have an opinion. I feel like there's just information and variables we haven't discussed that I'd just like a response on.
Right.
So I do want to clarify, I'm actually not exerting an opinion here, but I just realized I had different questions for them.
Yeah, I think that's good. Thank you.
Gotcha. Okay. The only other piece, Superintendent Moore, you touched on it earlier. I think when we talked last Tuesday, we talked about metrics and then a possible decision around metrics. And then there was a conversation where the importance of a good plan was more important than having defined metrics. Do you need the board to come out and say or sort of define some specific metrics, or are we okay with where we are now? Tell me what sort of guidance you need around that from the board.
So I do not think that we're asking from the board to define a specific metric as a component of adopting this plan, because we've considered what the metrics have to say to us. We've looked at the trends. I've spoken to Wake County Health Department. I've spoken to North Carolina DHHS, given the work also with the ABC Science Collaborative. I think moving forward, what may happen with the metrics is that's the type of thing that we would build into a dashboard moving forward so that we can track what's happening as one of the components of the reopening.
Okay. And I think Mr. Hagerty asked about a dashboard. I'll put you on the spot, but how soon do you see something like that being able to be to put in place?
So
would that be prior to the 26th when we open? And
oh yes, I think we can have something ready prior to opening. Yes, you know, I think that's certainly doable.
Okay.
I do want to add one piece to what you are you're proposing as next steps, and I just want to sort of, I guess, put it in my words so that we're all on the same page. Sure. So what we will bring to the board next week, and based on the feedback tonight, likely split a recommendation around what the reopening plan for in-person, what the return to in-person plan is for pre-K to 5th grade, and then either split 6 through 8 and 9 through 12, or do 6 through 12, depending on the will of the board. And in all of the plans right now, we are proposing a rotational entry that allows smaller groups of students to engage with teachers and get acclimated to the processes, the new norms, what it means to return to school. It would stay in a 3-week rotation for 6-12 is what we have put on the proposal. It would move to a fully in-person for pre-K to 5, and then and pre-K to 12 regional programs. And then embedded in all of that, something that I don't want us to lose would be the recommendation that we would also include an additional, we would ensure that every week had a remote learning asynchronous day as we moved through the rest of first semester. We know that some of those are already there, but that we would provide with you with the information of where those additional days would also occur.
Yeah.
Well, and I would ask if that asynchronous day could just be an overall, any changes to schedule that can lessen screen time and some stresses that the students and families are expressing. That would be helpful.
Yeah, I think that's part of the reopening plan, but that's like this little side project that we got going on right now. Yes.
Chair Sutton, the only thing I would love to also have a little bit more information about is like clear examples of supports that will be in place for particularly our K-5 teachers to help either suggestions or scenarios or examples that where they are going to be able to balance the face-to-face with the cohorts that are remote. I really feel that would also help build some confidence about how this is going to be possible. It's been acknowledged that there is no good plan B multiple times, but I do think that's important to have in place.
Okay.
Superintendent Moore, you good?
I got it.
Okay.
I completely agree with that, Heather.
So does, and I'm sure that Drew and Edward do too.
Okay. That seems to do it in terms of decision points for next week. Anything in terms of the supporting components. I know there's no decision point around those, but the other part that you brought to us in terms of the staff readiness, the operations component, anything around there that needs to be addressed, discussed, highlighted.
Chair Sutton, we had talked about the class size for our upper elementary grades. I just want to make sure that that is in there. I know Superintendent Moore.
I've already sent that email.
Thank you.
Okay. And the only other thing I have, just sort of a note, just continuing to sort of update us on where we are in terms of PPE, sanitizer, and those things as those things continue to be brought into the district and then dispersed to the schools, so that we're clear to the community and staff that as we acquire all of those things that we are ready and things are in place to again continue building that capacity and confidence that we're ready to open schools safely. All right. If there are no other questions, Superintendent Moore, any final words from you?
I just want to thank all of you for your questions, your commitment to teachers and families and students. I think, you know, as I mentioned earlier, it is important that we coalesce around how we support our students and our teachers and our families in this community, and find ways to collaborate and work together towards the end of what we see in our core beliefs for our students and making sure that we are living those out by how we work together. So thank you. And a special thank you to Dr. Benjamin for joining us.
Yes. Thanks, Dr. Benjamin, even though he's not here. Thank you to you, and to your team. And I think we did exactly what we were set out to do today. And I was reviewing the dependencies that inform these options. We've examined the features of a proposed return to in-person for consideration. And we will reconvene in a special call meeting, board meeting on Tuesday. Is it Tuesday or?
It's Tuesday, yeah.
Tuesday. I thought I heard someone say a week from today. It was actually Tuesday, September 29th, not Wednesday. So it'll be Tuesday, September 29th, a special call board meeting to adopt a plan for reopening Wake County Public Schools. So with that,
what time?
So we're looking at it being after the policy committee. Normally policy ends around 5, but given some of the feedback from today and a couple of other things, we probably wouldn't start the board meeting until 6. It might be 6:30, but you know, we're looking in that range, somewhere between 5:30 and 6:30.
Thank you.
Thank you for that question. I know it would be in the evening. I'm not sure if we have an exact time. So with that, we will stand adjourned. Thank you, board members. Thank you, staff. Thank you to the public and community, all that have tuned in. We appreciate your patience and your attention to this meeting. And again, we stand adjourned. Thank you so much.
Thank you, Mr. Chair.
Thank you.
Thank you. Have a good night.
Thank you, Chair Sutton.
Thank you.
Thank you all.